Recording in progress.
Muy buenos días a todos. Usted está conectado al 59º Consejo Directivo de la Organización Panamericana de la Salud. En este momento vamos a dar inicio a la sesión. Very good morning to all. You are connected to the 59th Directing Council of the Pan American Health Organization. We will initiate the session at this point. I would like to invite the Minister of Health of Colombia, the President of the 58th Directing Council, to take us through the session. Señor Ministro de Colombia.
Distinguished Minister of Colombia, you have the floor so that we can officially begin this session. Thank you very much, Dr. Monica. Special greetings to all the heads of state and government with us in this meeting, Dr. Carissa Etienne, Director of PAHO, the members of the Directing Council, as well as delegations from all countries present with us today. With these words, I would like to kick this council meeting off and to give the floor to the Secretary, the Deputy Director of the Pan American Health Organization, Dr. Mary Lou Valdez, so that she can report to the Directing Council in connection with the quorum. Ms. Valdez.
Thank you, Mr. President, and good morning, everyone. The Rule 5 of the Rules of Procedure reads as follows. The presence of a majority of members and associate members shall constitute, I hear a background, but shall constitute a quorum for the opening of the session of the Directing Council. As there are delegates from 29 member states clearly identified and connected to the virtual platform, it is therefore my pleasure to inform you, Mr. President, that there is a quorum. Back over to you, Mr. President. Thank you.
Muchas gracias, señor Marilu.
Thank you very much, Mary Lou. Due to the fact that my country, Colombia, was the president of the 58th Directing Council in 2020, I have to preside over the deliberations of this council meeting until a new president has been elected for the 59th Directing Council. Distinguished members and participants in this 59th Directing Council of the Pan American Health Organization. 20 months have elapsed since the first identification of a COVID case in the Americas. Today, the continent brings us to 87.5 million people infected and 2,163,000 deaths. And it is the most impacted region at a global level because of the pandemic. All countries have had to deploy urgent efforts in order to respond from our health services to the pandemic. We've invested hundreds of millions of dollars in order to procure and to build the capacities to diagnose, to procure intensive care units, acquisition of personal protection equipment for health workers, the development of options and information systems, as well as communication strategies, and also building capacities for decision-making processes and the development of health policies in environments of huge uncertainty. For years, without a lot of success in our countries, we stressed the principle of health in all policies. The pandemic transformed that healthy principle into reality. All social activities and various economies and activities in our societies depended on ministries of health, with activities involved in all sectors of society that were regulated by biosecurity, biosafety protocols, quarantines, and non-pharmacological measures that we had to adopt 2/3 into the pandemic. We've had to preserve life. That was our responsibility, but also to rekindle our economy, employment, mobility, and the development of life itself all across the board. We had never had a greatest involvement in the operation of our societies like today because of the impact of the pandemic. This mission has been left in our hands in conditions of greater uncertainty, limited knowledge on the pathological condition of the virus, and not very good control of biological substances and medical inputs that are necessary in order to face from all health services this situation posed by the pandemic. Today, after 20 months, 51 countries and territories in the Americas have begun vaccination against COVID-19. We have over 1 billion doses administered. 50% of the population in the Americas has received at least one dose, and 33% has complete vaccination schedules. An ethical process in an environment of a lack of supplies, difficulties in access, and a very high investment made by our countries and in our countries. We have huge challenges caused by a pandemic that leads us to the most challenging of the endemic situations that will represent huge efforts in the years to come. The emergence of highly communicable variants poses a challenge when dealing with the natural immunity still unknown in our countries. The fragility immunity of older adults is also at stake, as well as the sequelae of the diseases caused by COVID-19, the deferred care of that which is not COVID, and the burden of a disease linked to chronic diseases that were not well taken care of during this period. However, the greatest challenge will be to understand and to act when dealing with a future pandemic. The region ought to consolidate as of now its health security understood as the definition of strategic and health capacities in order to protect our citizens. Therefore, we ought to build capacity in research, diagnosis, production of vaccines and medicines, consolidation of information systems, and obviously the coordinated response capacity. It is a challenge for PAHO and for those countries, and we cannot give up or remain lagging behind. The continent ought to analyze a response to COVID under the principles of security, efficiency, and quality, to share this information through digital vaccination certificates, as we will discuss during this directing council, ought to be the beginning of a joint proactive action to be taken by all countries in order to consolidate the health security that will enable us to have a better response in the medium term to COVID and to future pandemics. Towards the end of my job as president of the directing council, I would like to express my very special gratitude that I address to all delegations, all countries, for their participation and their attention to all scheduled events. Most especially, my gratitude is addressed to Dr. Carissa Etienne and the officials of PAHO, the representation of the office in Colombia, Dr. Gina Tamin from the country office, as well as all members of the staff of the Pan American Health Organization, Dr. Monica Zaccarelli, as well as all the others for all the support provided in order to be able to hold the presidency during last year. My gratitude to all, and from Colombia, an appeal to all countries in order to deploy our greatest effort and our greatest push in order to obtain the best results as a region when dealing with this COVID-19 pandemic and to face future health challenges that will come to us in future years. Thank you. For this event, we have some special guests, the presidents, heads of state and government of different countries, and we offer our special greetings to these heads of state, and we will give the floor to them during the opening of this session. First of all, I'd like to give the floor to the President of Chile, Honorable Mr. Sebastián Piñera. Please go ahead, President of Chile. I thank PAHO for this invitation to share with you the Chilean experience in managing, combating, and controlling this coronavirus. Only a year and a half ago, the world faced a virus that was unknown to us. We did not know how this was spread, and we did not have any treatment, any medicine, anything to solve that. But in less than 10 months, science was able to find responses in order to contain the spread of the pandemic. And while science was up to par to this challenge, policies did not comply with their mission because if states had shared information, coordination of efforts from the very beginning of this pandemic, and if we would have taken measures with the same speed and conviction as the scientific community has done, undoubtedly the situation now would be much better. Therefore, I attach a great value to the space where countries can talk, share experiences, and cooperate in order to better face this health crisis. Chile prepared the country at an early stage to deal with the pandemic. So on January 2nd, 2020, we organized our first working meeting in order to design an emergency plan of action in order to face the coronavirus crisis. The plan started off by bringing together the public and private health sectors to facilitate their coordination and their capacity, especially in hospital beds. In February 2020, we managed the early procurement of mechanical ventilators, which enabled us to triple the use of ICU beds in the health system with their respective medical teams, respirators, ventilators, and technologies. We strengthened testing, traceability, and isolation, multiplying by 28 the capacity to perform testing, PCR tests in the country. We had over 10,000 tracers and trackers, and having increased the number of beds in health facilities. And thanks to these decisions and actions, the health system in Chile never collapsed. And thanks to God, it was not necessary to face the dramatic dilemma of the last stage. And we always delivered on time the medical inputs and supplies that our patients needed. At the beginning of last year, the Director General of WHO made an appeal so countries would increase their capacity for detection of coronavirus. And he sent a very simple message. In January that year, Chile had already performed the first PCR test, and we were strengthening the diagnostic network, multiplying the capacity to have a PCR test. Chile has a public-private network of over 180 laboratories, and now that allows us to process 90,000 tests every day, which has enabled us to process over 21 million tests ever since the pandemic began. And this places us as a country in Latin America that has performed more PCR tests per 1 million inhabitants. Likewise, we have a network of over 13,000 people that do tracking and traceability actions throughout the country, which is key to detect, to trace and isolate patients and contagion and spread of confirmed cases. To reduce the spread of the virus and isolate confirmed cases and their close contacts, we empowered over 100 homes, health homes that offer 10,000 capacity for those who need it all throughout the breadth and width of our country. They're free and they're made available to the people who need it, thus ensuring the services and basic requirements. An essential pillar of the strategy, of the health strategy, has been the plan step by step that we implemented in July last year, and that is made up by 4 phases that go from the quarantine all the way to the reopening, and that are enforced depending on the epidemiological conditions in each community in our country. And they regulate the movement of people, the operation, and the capacity of education establishments, other establishments in public places and in private places. The progress or backlog in the different phases of the plan depends on the conditions that are objective and quantifiable, such as epidemiological indicators, the number of contagion incidents, the assistant network, the progress in the vaccination plan, as well as other variables. Aware of the fact that the protection of life and health of our fellow citizens will depend in a significant way on the timely procurement of vaccines vaccines against COVID. In April last year, we begun contact with the main laboratories that were doing research and that were developing a vaccine against coronavirus. We came to agreements and we entered into contracts with the different laboratories that allowed us to ensure vaccines for the entire population older than 3 years in our country. And thanks to this early initiative and the admirable commitment of health workers, Chile became the first country in South America in triggering and beginning the vaccination process. To date, over 30 million doses have already been administered, which is translated in saying that almost 3/4 of our population is already fully vaccinated. On July 1st, we began vaccination of minors between the ages of 12 and 17. And a few days ago, we've also included children between the ages of 6 and 12. And we've also begun vaccination with boosters for people older than 65. Over 2/3 of people older than 52 that had the full vaccination schedules already have a booster. Together with promoting the network of health protection, we built a social protection network in order to mitigate, to offset the devastating social impact brought by the pandemic and the recession of the global economy. This social protection network or safety net has provided assistance or relief to families, workers, and small businesses in close to 10% of our GNP, and has been able to reach with protection and assistance that is provided to 16 of the 19 million Chilean inhabitants. We had a drop in the GDP of 5.8% last year, and also the destruction of over 2 million jobs. This represents more than 22% of the total number of employed today. But in spite of that severity of the crisis, we came back to the pre-pandemic economic activity level in March of this year, so 12 months after having the first case. And we've also been able to recover 1.9 million jobs lost. And this year, our economy will grow in around 10%. I want to finish this statement by stressing the lessons left by the pandemic. For example, the value of the family, the need for being more humble and to acknowledge our weaknesses, the importance of the commitment of the state and the cooperation between the state and civil society. And last but not least, just like any individual can be safe from the pandemic on its own because they need the responsibility and solidarity of their community, countries cannot be saved on their own if we do not have the responsible and solidary cooperation by the international community. Deep down, no one will truly be safe until we are all reasonably safe. Therefore, I want to reiterate the urgent need for reinforcing the institutionality, multilateral institutionality, and in order to achieve this, and with the support of WHO, PAHO, and also the European Union, we are promoting a new treaty for prevention and response before future pandemics. No one can state surely that we will not face new pandemics in the future. But today, we must assure that when this happens, we will be much better prepared and we will be able to act swiftly, quickly, with coordination, with solidarity in order to prevent and better attenuate the consequences of future pandemics. Thank you very much. Thank you very much for your words, President Piñera. Next on the program, we have the President of Costa Rica, Honorable Mr. Carlos Alvarado. Unfortunately, he will not be able to be with us because of reasons beyond his control. And therefore, we now give the floor to the Director of the Pan American Sanitary Bureau, Dr. Carissa Etienne, Honorable Dr. Carissa Etienne, so that she can address her welcoming remarks. Dr. Carissa, you have the floor.
Thank you, Mr. President. Outgoing President of the 58th Directing Council, Honorable Dr. Fernando Ruiz Gomez, Minister of Health and Social Protection of Colombia, President of Chile, Your Excellency, Mr. Sebastian Piñera, Secretary of Health and Human Services of the United States of America, Honorable Javier Becerra, Secretary General of the Organization of American States, Honorable Luis Almagro Lemus, President of the Inter-American Development Bank, Honorable Mauricio Clavel Caron, Director General of the World Health Organization, Dr. Tedros Ghebreyesus, Honorable Ministers and Secretaries of Health of member states of the Pan-American Health Organization, distinguished member state delegates, eminent members of the diplomatic corps, representatives of non-governmental organizations in formal relationships with the Pan-American Health Organization, representatives of the United Nations and other specialized agencies, fellow PAHO and WHO colleagues, honored guests, esteemed ladies and gentlemen, a very good morning to you all. I am pleased to extend a very warm welcome to all of you to the 59th Directing Council of the Pan-American Health Organization. I am particularly pleased to greet the distinguished President of Chile, the Secretary of Health and Human Services of the United States, and the President of the Inter-American Development Bank to this health forum. I especially welcome all the first-time attendees of the meetings of the governing bodies of PAHO. I must express my genuine thanks to all member states for your steadfast and unwavering commitment to our joint quest to improve the health and well-being of all peoples in the Americas, particularly during this very complicated and challenging time. Before proceeding further, I would also like to take this opportunity to extend our deepest condolences to the people of Haiti on the tragic loss of life resulting from the 7.2 magnitude earthquake, which occurred on the 14th of August, 2021. Regrettably, we note that the destruction of property, the displacement of families and businesses, and disruption of lives were further complicated by ravages of Tropical Storm Grace. We stand in solidarity with you, our Haitian friends, as you rebuild and recover. Sadly for us in the Secretariat, we also mourn the untimely loss of a member of staff, Dr. Usman Tori, an international PAHO consultant, whose young life was snuffed out by the earthquake in Haiti. On behalf of the Secretariat, member states, and the entire PAHO family, I wish to convey our heartfelt sympathy to his wife and children in Guinea. We are meeting today amidst the unrelenting and tragic march of the global COVID-19 pandemic, which as of Friday, the 17th of September, had claimed more than 2.16 million lives in the region of the Americas, with 87.6 million cases having been recorded. The mind struggles to comprehend the sheer enormity of these statistics, and our hearts strain under the weight of so much loss. The Secretariat extends our deepest sympathies to the families, friends, and communities who have suffered such profound consequences of COVID-19. Honorable delegates, the agenda of this 59th Directing Council has been primarily constructed around some of the critical lessons that which we have learned from the COVID-19 pandemic, and with a keen eye to building a better future. Our inability to readily source and procure personal protective equipment, ventilators, vaccines, oxygen, medicines such as antiretrovirals, and other essential health technologies heightened our vulnerabilities and severely compromised our pandemic response. However, this alarming circumstance has galvanized us into recognizing the obligatory need for regional self-sufficiency in health technologies. On this path towards regional self-sufficiency, PAHO recently launched a platform to boost regional vaccine production efforts, and I am happy to report that the Inter-American Development Bank the World Bank and other partners have already expressed interest in collaborating with us to advance this agenda. The COVID-19 pandemic has accelerated the need for rapid adoption of digital solutions in public health. Information systems and digital health solutions that were accessible and ready to use proved indispensable for the delivery of care at all levels of the health system. Digital solutions will also be key to post-pandemic recovery and rebuilding, and will require systemic changes to drive innovation. The emergence and spillover of the SARS-CoV-2 virus into human populations and the consequent global pandemic should leave us with no doubt that the adoption of a One Health approach is even more critical now, given the shrinking global village in which we live. The One Health proposal will allow for greater coordination, collaboration, policy coherence, and engagement across the different sectors of human, animal, plant, and environmental health. Extensive deforestation and destruction of sylvatic habitats, as well as numerous other activities, have intensified the contact between animals, people, and disease agents. Let us not forget in this region the costly yellow fever outbreak in Brazil in between 2016 and 2019. While countries of necessity focused on the COVID response over the past 18 months, certain essential public health programs, such as immunizations, cancer, malaria, HIV and TB, and maternal health were disrupted with important negative impacts. What is noteworthy is that after every disaster, be it a natural disaster, a major disease outbreak like Ebola, or even a financial crisis, we all reaffirm our commitment to building resilient health systems. And sadly, if nothing else, this pandemic has demonstrated that our continuing failure to deliver on this commitment does indeed carry a high price tag in terms of the millions of lives lost and also the economies that are destroyed. I want to urge us all to invest in our health systems and swiftly ensure their transformation so they have the capacity to respond to the needs of all people every day and to better respond to pandemics and other disasters when they do occur. Over the next several days, this Honorable Assembly will also discuss and deliberate on other agenda items, including the financial report of the Director, matters related to the collection of assessed quota contributions, and strengthening of PAHO and WHO preparedness for and response to health emergencies, among others. It is my sincere hope that these varied deliberations will converge and intersect at one common and enduring objective. That is that of saving lives and improving the health and well-being of all of the peoples of the Americas. Distinguished delegates, your boldest and most creative ideas will be required as we convene for this week-long exchange and decision-making. We must work in a spirit of solidarity and ensure that equity remains central to our ideas and policy recommendations, so we will truly leave no one behind as we rebuild and recover from the unprecedented catastrophic occurrences in our lifetime. Let me thank you very much, and once again, a very warm welcome to you all. I look forward to our deliberations and your active participation. Thank you.
Muchas gracias, doctora Carissa.
Thank you very much, Dr. Carissa Etienne. I now offer the floor to the Secretary of the U.S. Department of Health and Human Services, the Honorable Xavier Becerra. Dr. Becerra, the floor is yours.
Distinguished leaders and delegates, I am honored to welcome you to Washington, D.C., albeit virtually, for the Pan American Health Organization's 59th Directing Council. My heartfelt gratitude to Director Etienne and Deputy Director Valdez for their tremendous leadership in combating this pandemic. I know PAHO and its staff have gone above and beyond the call of duty to fight COVID-19, and we all thank them for their incredible work. Our region, the Americas, is in the fight of its life. And it is a fight we must and will win. But in order to win, we must to make each other stronger. And that starts with strengthening our health systems, domestically and globally. Simply put, we must build a stronger, more effective, more agile system that has wherewithal and the authority to prevent or control the next outbreak before it becomes a pandemic. The United States is committed to strengthening the World Health Organization. And through the Working Group on Preparedness and Response, WHO member states have a unique opportunity to build consensus for a modern institution that can harness the lessons of our experiences with the speed of our digital world. The United States
major gaps in accessing economic, social, cultural, and political rights in our hemisphere. Despite the good news on vaccination, we're alarmed to see that close to
América Latina y el Caribe aún no está completamente vacunada, como lo ha advertido recientemente la OPS. La distribución equitativa de las vacunas.
equitable distribution of vaccines in the region must be a top priority. This was discussed in our political forum and continues to be discussed, but we need to continue working to take on these challenges in order to address these inequity. We cannot come out of this with more inequality and with fewer rights for all people. On the contrary, this needs to be an opportunity to provide more rights to more people. This is a challenging time, and we need to once again stand up for the values that we believe are indispensable for human lives and development. We need to ensure that no one in our hemisphere is left behind, not for a minute more. The OAS will continue to work relentlessly to make sure that there is progress in health efforts in our region. And our political forum is going to continue to be an open and candid space for dialogue so that the OAS, PAHO, the IDB, and other member countries can all have a great platform to share ideas and propose solutions in order to develop a more inclusive and comprehensive public policy. We'll continue doing our part in order to advance solidarity and equality alongside the PAHO in order to protect the most vulnerable, and so that we can also ensure a safe and healthy future for all. Thank you. I thank the Honorable Luis Almagro Lemes, Secretary General of the Organization of American States. I now offer the floor to the President of the Inter-American Development Bank, His Excellency Mauricio Claver Carone. President, you have the floor. It seems that we may be experiencing some technical glitches with the connection. Once again, we offer the floor to the President of the IDB, Mr. Mauricio Claver Carone.
¿Se encuentra conectado el señor Carone?
Is Mr. Claver Carone connected?
En vista de que parece tenemos algunas dificultades para la
It seems that we're experiencing some technical difficulties with the connection with the President of the IDB. Let us now, in the meantime, turn the floor over to the Director General of the World Health Organization, Honorable Dr. Tedros Ghebreyesus. Dr. Tedros, you have the floor.
Damos unos momentos porque al parecer tanto el doctor Claver Carone como el señor Tedros han
I'd like to
perdido-
ask for everyone's patience. It seems that both Dr. Tedros and President Mauricio Claver Carone have had some connection issues. If we can just wait a few moments as we try to figure this out.
Veo que ha logrado felizmente-
President Claver Carone, I am happy to see that your connection is back up.
Le concedemos el uso de la palabra. Adelante.
We would like to now offer you the floor. President Claver Carone, the floor is yours. Good morning, everyone. It is an honor to be in this opening session of this 59th Directing Council of the Pan American Health Organization at the 73rd session of the Regional Committee of WHO for the Americas. I'm speaking to you from New York City, where I am for the General Assembly of the UN. And I'd like to take this opportunity to hail the leadership we have seen from the director and the entire staff. On behalf of the IDB, I would like to also thank the entire staff of PAHO and all of the sister organizations who work in order to ensure the well-being of the Americas, particularly during a time of crisis. We are proud to work very closely with you today, as we have seen this work has happened since the first case was detected in the region. It is only by working together that we are going to be able to overcome this pandemic and take on the challenges that we face as a region and as an entire planet. International cooperation and solidarity are now more important than ever. Ministers of Health, all of you know very well how much our people have suffered in our countries given the impact of the pandemic, and you have been entrusted with the task of tackling this historic pandemic. I would like to express my deepest gratitude to you all on behalf of our member countries for everything you have done during this time to curb transmission of the coronavirus and also mitigate the impact, as well as to advance in the national vaccination drives. This work helped to ensure that there were essential supplies for essential workers. I would like to also thank all of the health professionals in our countries who have been and continue to be the true heroes in this fight. As you all know, the global population is facing this historic challenge in trying to ensure that there is inclusive, sustainable, and robust recovery post-crisis. Latin America and the Caribbean has been one of the most affected regions in the globe because of the scope of this pandemic, and we all have this challenge of ensuring recovery. And this is just one of a number of crises affecting our region. We're also looking at the destruction and the intensification of climate change, migration from the region, inequality and corruption, just to name a few. Our health systems have been tested like never before, and we have seen how this has impacted supply and also a number of other services like sexual, reproductive information and services, among others. We've also seen the consequence of this pandemic on mental health, as well as a number of other issues that have been exacerbated, like violence against women and children. Even though there is no way to truly state when the end of this pandemic will come, we need to continue to do our work so that we can bring that day closer every day. What you can certainly count on is on the IDB to continue shouldering its responsibility to make sure that we continue focusing on the post-pandemic. We're here to ensure that our region is better off in every sense of the word, economically, on the health side, and socially. We have made adjustments to our facilities and also streamlined our procedures at the bank in order to contribute to getting the necessary resources so that we can do that more quickly as well. That has all helped to strengthen our response to COVID-19, and also this is beneficial for our member countries. And we did that in record time with mobilization and government resources and also private sector resources. We also raised an additional $1 billion specifically to ensure that there is rollout, procurement, and distribution vaccine resources available through COVAX. In the Dominican Republic, for example, we used our credit facility for emergency contingencies in the face of natural disasters. So this was a tool that we modified last year in order to address the pandemic. Additionally, we also launched an innovative initiative to increase competitiveness of our borrower countries in order to procure vaccines with guarantees from the IDB. We'll continue to support countries to come out of this pandemic to strengthen the health services and also protect the most vulnerable and boost economic recovery and job creation. This is why it's important to ensure that access is broad and rapid to the vaccines for COVID-19 and also look at the health responses that have been the most effective. Equitable access to vaccines domestically and internationally continue to be a key way to ensure that we have a post-pandemic world that makes the most of these opportunities. PAHO, the IDB, and other international organizations will continue to work closely in lockstep to continue to support these procurement mechanisms so that we can also ensure that there is increased production of vaccines in the region. We believe that this moment should also be seen as an opportunity to boost digitalization and also regional integration in order to unleash a number of social and economic benefits that exist within our region. We believe that digitalization in the health sector is absolutely vital, which has been clear for public health surveillance, as well as increasing access to the use of services through telehealth services, improving communication, and also providing data for real-time decision-making, among other uses. In Argentina, Brazil, Uruguay, and other countries, we are working in order to broaden and increase telehealth services in order to increase coverage and to make it easier to access specialists. We look forward to continuing to work with PAHO in order to pick up the pace with our transformative agenda. It's important to highlight as well that COVID-19 has had a disproportionate impact on the most vulnerable, which highlights a need for taking specific steps to protect these groups in health, but also when it comes to the economy and social impact. We are proud of our programs like Salud Mesoamerica, which responded to one of the main root causes of mortality in this sector of the population through obstetric care and neonatal care. PAHO continues to be a key driver of progress in this area and also a key player in the entire host of actors who are doing their part. You, as ministers of health, continue to show your determination to playing a key role that could not be more important than it has been today. In closing, I would like to say the following. There's a lot of optimism, a lot of hope, given the, ironically, opportunities that this pandemic brought for economic growth in our region. I am fully convinced that the Americas can come out of this stronger, more resilient to future challenges. We must continue to work together in order to boost economic recovery. And the IDB, as a bank that delivers, is what is here to stay alongside you in order to work together. And we wish you all a great day. Thank you. Thank you very much, President Claver Carone, for your words. Let me now offer the floor to the Director General of the World Health Organization, who is joining us from Afghanistan, Honorable Dr. Tedros Ghebreyesus. Dr. Tedros, you have the floor, sir.
Thank you. Thank you, Your Excellency. Honorable Dr. Fernando Ruiz Gomez of Colombia, President of the Directing Council, Dr. Carissa Etienne, Regional Director for the Americas, Excellencies, dear colleagues and friends. Good morning. I'm pleased to be able to join you from Kabul, Afghanistan. I deeply regret that for the second year, we're not able to meet in person, but I hope that we will be meeting next year in person. Whether we can or not is up to us. It's in our hands. We have all the tools to stop transmission and save lives. Effective public health and social measures, rapid, accurate tests, life-saving oxygen, and vaccines. WHO's global targets are to support every country to vaccinate at least 10% of its population by the end of this month, 40% by the end of the year, and 70% of the world's population by the middle of next year. I'm pleased that in the Americas, almost 90% of member states have now reached the 10% target, but less than 1/3 of countries have reached the 40% target. WHO and PAHO will continue to support you through COVAX to increase the availability of vaccines. Even as we work to end the pandemic, we must learn the lessons it's teaching us. And your agenda this week reflects many of those lessons, including the need to increase local production, the importance of a One Health approach, the power of immunization, the importance of resilient health systems, and more. As you know, there have been several reports and reviews of the global response to the pandemic, including the report of the G20 high-level panel. As we have studied them, we see 4 critical areas for action. First, better global governance. There are several proposals for new governance mechanisms. It's vital that any such mechanisms are inclusive, equitable, and accountable. I believe a legally binding international instrument on pandemic preparedness and response will provide a much needed overarching framework for global health security, setting the rules of the game and enhancing solidarity among nations. Second, more and better financing for national and global preparedness and response. Crucially, any new financing facilities must be built using existing financial institutions rather than creating new ones that further fragment the global health architecture. Third, better systems and tools across the One Health spectrum. Already, WHO has taken steps to start building some of those tools. Earlier this month, we opened the WHO Hub for Pandemic and Epidemic Intelligence in Berlin, and several other initiatives are in development. And fourth, a strengthened, empowered, and sustainably financed WHO at the center of the global health architecture. In Kabul today, I have met with representatives of the Taliban administration to discuss how WHO will continue to work to support the health of Afghanistan's people. Earlier this week, I also had the opportunity to visit Lebanon to understand more about the challenges that country is facing and how WHO is supporting the health system. Both of these situations remind me of why the world needs WHO and why these countries need support. Both situations are dire. Their health systems is collapsing and people have started dying because of lack of access to essential medicine. With 194 member states and 152 country offices, WHO has a unique global mandate, unique expertise, unique global reach, and unique global legitimacy. But over several decades, it has been progressively weakened by a debilitating imbalance between assessed and voluntary earmarked contributions that distort our budget and constrain our ability to deliver what our member states expect of us. Redressing this imbalance is critical if WHO is to be the independent and authoritative institution the world needs it to be. I'm pleased that this week you will consider the report group on sustainable financing, and we look forward to your feedback. Excellencies, dear colleagues and friends, I leave you with 4 concrete requests. First, we seek your commitment to stay the course with a comprehensive risk-based approach to prevent transmission and save lives. Second, we seek your support for achieving our global vaccination targets in the Americas and around the world. Third, we seek your support for the development and adoption of a legally binding international agreement on pandemic preparedness and response. And fourth, we seek your support for a stronger WHO by supporting initiatives that strengthen its mandate and by committing to a historic reversal of the current imbalance between assessed and voluntary contributions. Excellencies, thank you all once again for your hard work and support for WHO at this very critical time. And we look forward to your continued support as we work together to promote health, keep the world safe, and serve the vulnerable. And I would like also to pass to all of you greetings from WHO staff here in Kabul, Afghanistan. And thank you so much, Your Excellency. Back to you.
Muchas gracias, doctor Tedros, por
Thank you
su-
very much, Dr. Tedros, for your remarks. We wish to thank everyone who has spoken today. Presidents, the heads of multilateral organizations, directors of healthcare services and facilities. We believe that your remarks have been absolutely vital in providing guidance to this council, which is also vital importance for the Pan American Health Organization. I'd like to now officially declare open the 59th Directing Council 73rd session of the Regional Committee for the Americas of the World Health Organization. On the next item, we have the appointment of the Committee on Credentials, and I'd like to offer the floor to the Secretary, Ms. Mary Lou Valdez, Deputy Director of the Pan American Sanitary Bureau, to report to the Council on the statutory provisions concerning this item. Secretary, the floor is yours.
Thank you, Mr. President. Please let me read Rule 31 of the Rules of Procedure. It reads as follows. A committee on credentials consisting of 3 members or associate members shall be appointed by the Directing Council at the beginning of the first meeting. This committee shall examine the credentials of the delegates of members and associate members and representatives of observer states and report to the council thereon without delay. Thank you, Mr. President. Back over to you.
Muchas gracias.
Thank you very much. Pursuant to the rules of procedure, it falls on this council to nominate the Committee on Credentials. And there was the meeting of the heads of delegation, and following that meeting, I would like to nominate Panama, Paraguay, and St. Martin. Does the council agree?
En vista de que no he escuchado ninguna objeción, declaro a Panamá,
I hear no
Paraguay.
objection, so I'd like to declare Panama, Paraguay, and St. Martin elected for the Committee on Credentials and invite one delegate from each of these countries to meet virtually to examine the credentials received and report to the council without delay.
Informo que la Comisión de Credenciales se reunirá inmediatamente e
I'd
informará
like to inform you that the Committee on Credentials will meet immediately and will also report
en las deliberaciones de la Comisión.
on the deliberations.
Pasamos a considerar el siguiente punto.
We will now move on to the following item. I offer the floor to the Secretary
Acerca de las
so that she may report
relacionadas
on
con este punto.
the statutory rules on this item,
Adelante.
the election of officers. The floor is yours.
Thank you, Mr. President. Rule 16 states, the council shall elect a member or an associate member to the presidency, 2 vice presidencies, and the office of the rapporteur, respectively. They shall hold office until their successors are elected. Each elected member or associate member shall designate a person on its delegation to serve in that office for the duration of the session. Thank you, Mr. President, and back to you.
Muchas gracias, señora Marilu Valdez.
Thank you very much, Ms. Marilu Valdez.
Para la presidencia.
Election of officers.
Consejo que en virtud del acuerdo logrado
I would like to inform the council that by agreement reached in the heads of delegation meeting last week,
para ocupar la presidencia a Jamaica.
Jamaica has been nominated to the presidency. If there are no objections, we declare Jamaica elected by acclamation, and we invite Jamaica to assume the presidency. Please, Jamaica. Please, Mr. President, Jamaica.
President of the 58th Directing Council. Thank you. Honorable Minister Fernando Rose, President of the 58th Directing Council. Honorable Vice President of Ecuador, Senor Alfredo Borrero. Honorable Ministers and Heads of Delegation. Honorable Dr. Caricia Etienne, PAHO Regional Director. Honorable Dr. Tedros, World Health Organization Director General. Esteemed colleagues, ladies and gentlemen. I first want to thank the Council for their vote of confidence and show of solidarity in electing Jamaica to act as president for the 59th PAHO Directing time when the region is facing the ongoing threat of the COVID-19 pandemic. These are unprecedented times for the Americas and indeed for the world. The region has been significantly impacted by the COVID-19 pandemic, not only therapeutically, but also socially, economically, and politically. The virus has caused major disruptions to health service delivery and has severely challenged our public health system, putting strain on human, technical, and financial resources. WHO figures show that there have been over 226 million confirmed cases of COVID-19 and over 4.5 million deaths up to September 17, 2021. On both accounts, the region of the Americas have had the highest numbers of over 87 million reported cases of COVID-19 and more than 2 million deaths. 5 countries in our region have ranked in the top 10 for cumulative deaths globally. Our salient aspect of this pandemic is that its impact has not been equal across countries in terms of cumulative cases and deaths and broader socioeconomic effects. Vaccines have become a critical tool for recovery, yet a disproportionate amount of the over 5 billion doses administered globally has gone to high-income countries. While some countries in our region have vaccinated over 50% of their population, others remain below 3%. More than a third of countries in Latin America and the Caribbean are yet to vaccinate 20% of their populations. Jamaica has faced several challenges in having a reliable and consistent supply of vaccines. I would like to take the opportunity to thank our neighbors in the region, Mexico, United States, and Canada, for supporting us in this endeavor. Although inequality has always been a defining feature of the global economic order, COVID-19 has sharpened inequalities, raising critical questions as we move towards COVID-19 recovery. Questions about the role of multilateralism in addressing shared public health challenges. Although our region and our health systems are diverse, and it is important to recognize this, as a region, collectively, we share a common vision for public health, which is to improve the health and quality of life of people in the region and to put our societies and economies back to normal in the shortest possible time. Now more than ever, the region must act as a united force to build capacity and resilience in our public health systems. PAHO has been a significant role in this regard and continues to be a unifying force in the region. Going forward, we must commit to build a more robust healthcare system capable of addressing current and future threats through greater efforts to address quality of access to essential medicines and health technologies, sustainable health financing, greater emphasis on primary health care, more collaboration around human resource training, support, and recognition, addressing the persistent scourge of NCDs that make our populations more vulnerable to man-made or natural disasters, and building the capacity for emergency response to disasters and emerging and re-emerging diseases that have become a recurring challenge for countries in the region, and in particular, small island developing states. Finally, Your Excellencies, members of the Council and delegates, let me reiterate the point that improving healthcare across the region and returning our societies to a sense of normality or a new normal will depend on our willingness to encourage more equitable policies, deepen multilateral cooperation, and address current weaknesses in the global public health system. The strengths of partnerships on this road to recovery are fostered by greater collaboration and less fragmentation in our efforts. Now is the time for us to join hands and hearts. Together, we can succeed. We are as strong as our weakest link. I thank you. We now turn to the election of the vice presidents. I would like to inform the council that by agreement reached in the heads of delegation meeting, Ecuador and El Salvador have been nominated to the vice presidencies. If there are no objections, I would like to declare Ecuador and El Salvador elected by acclamation as the two vice presidents of the council. I see no objections, and therefore Ecuador and El Salvador are elected by acclamation to serve as the two vice presidents. We now turn to the election of the rapporteur. I would like to inform the council that by agreement reached in the heads of delegation meeting, Chile has been nominated to serve as the rapporteur. If there are no objections, I would like to declare Chile elected by acclamation. I see no objections and therefore declare Chile elected as rapporteur by acclamation. I would like to inform the council at this time that the appointments will appear as a decision in the final report. We now turn to item 2.3, establishment of a working party to study the application of Article 6B of the Constitution of the Pan American Health Organization. I would like to ask the Secretary to inform the Council on the statutory provisions related to this item.
Thank you, Mr. President. Article 6B of the PAHO Constitution provides that if a government fails to meet its financial obligations to the organization by the date of the opening of the Pan American Sanitary Conference or a meeting of the Directing Council, by being in arrears in an amount exceeding the sum of its annual payments of contributions for 2 full years, the voting privileges of that government shall be suspended. Nevertheless, if the conference or the Directing Council is satisfied that the failure of the government to pay is due to conditions outside or beyond its control, it may permit the government to vote. Traditionally, it's been the practice of the Directing Council to appoint a working party made up of delegates of 3 member states to study the application of this article. Thank you, Mr. President, and back over to you.
I would like to propose Antigua and Barbuda, Honduras, and Peru. If there are no objections, I declare elected Antigua and Barbuda, Honduras, and Peru to the Working Party and request them to meet virtually at the end of the morning meeting. The Working Party will be assisted by the Secretary. I see no objections and therefore declare Antigua and Barbuda, Honduras, and Peru to the Working Party. I would like to inform the Council the designations will be recorded also as a decision in the final report. At this point, I'd like to give the floor to the Secretary, Ms. Valdez, for some announcements, and that is before we take a short 10-minute break. Madam Secretary.
Thank you, Mr. President. If folks will please bear with me. In accordance with Rule 58 of the Rules of Procedures of the Directing Council, the working languages shall be those of the members of the council. Therefore, interpretation is being provided in English, French, Portuguese, and Spanish. You may choose the language at the bottom of your screen on the icon Interpretation. Instructions for requesting the floor are very similar to that of a face-to-face meeting. To request the floor, you must click on the hand or raise hand icon, which is also found at the bottom of your screen. Please be aware that if you click on the hand for a second time, you will actually annul your request and be removed from the list of speakers. So please only click it once until after you have spoken. As usual, the member states are asked to limit their interventions to 3 minutes. As you have seen here, there's a traffic light system that will help our delegates keep track of time during their interventions. At the start of the intervention, the traffic light in the room will be green and it will remain so for 2 minutes. It will then change to orange or yellow, indicating that 1 minute remains in the allotted time for the intervention. And then the light will switch to red when the delegate's time is over. Delegates are please asked to turn on their cameras and give their name and country each time you may take the floor. This will facilitate greatly the official record keeping of your interventions. Members and associate members will be recognized before observer states and institutions. We would also like to remind our delegates to send their interventions to interventions@paho.org, as this will help with the preparation of the final report of this session. Please ensure that each of your intervention includes the name of your country and the item written in full, along with its corresponding agenda item number. The Committee on Credentials, as the President noted, will meet immediately after it is appointed. The Working Party to study the application of Article 6B of the PAHO Constitution will meet virtually today at 12:30 and at 8:30 a.m. tomorrow morning. Member states wishing to submit comments to the final and progress reports, please, we ask that you use the email address gbo pahot.org. Again, thank you for your patience, and Mr. President, back over to you.
Convene our session at 11 a.m. Thank you very much. Thank you very much. As we had said, we would have returned at 11 a.m., but there are still some deliberations taking place, the Committee on Credentials, and so we will ask for some patience for an additional 5 minutes or so when they will report back on their deliberations. So kindly allow for another 5 minutes. We'll get back to you 11:05, 11:07. Thank you. Okay. Should I hit this thing when we start? Okay, thank you very much for rejoining. We are on item 2.1, first report of the Committee for Credentials. And I now yield the floor to the delegate of Panama, President of the Committee on Credentials. Is the member from Panama ready to give a report?
Buen día, señor presidente.
Good morning, President Thais Noriega. I represent the Health Ministry of Panama. We're still waiting on the Committee on Credentials to finalize the report. As soon as we receive that, we'll be able to read it for the Council.
Okay, thank you for that. As a result, therefore, we have to wait a bit longer in order to ensure that the process is complied with. So I will ask again for some patience to delegates until those deliberations are completed. Thank you. Okay, thank you very much. We are still awaiting final report on item 2.1, the Committee on Credentials, but in the interest of time, we would like to proceed and then return to that agenda item. So I'm going to move now to item 2.4, the establishment of the General Committee. I would like to ask the Secretary to report on the statutory provisions concerning this item. Madam Secretary.
Thank you. Thank you, Mr. President. Rule 32 states, the council shall establish a general committee consisting of the president of the council, the 2 vice presidents, the rapporteur, and 3 delegates elected by the council from among those members or associate members not already represented on the general committee. The president of the council shall serve as the president of the general committee. Thank you, Mr. President, and back over to you.
Secretary, I would like to propose that all matters related to the dispatch of business of the council that would have been dealt with by council itself. I make this proposal because of the logistical limitations presented by holding the council through a virtual platform. With this proposal, therefore, exercising the presidency of the council, I aim at ensuring an effective management of the meeting. Are there any objections to this proposal? I see no objections, and I would like to inform the council that this decision will be reflected in the final report. I see that the Credentials Committee is ready, so I am going to ask for a return to agenda or item number 2.1, first report of the Committee on Credentials. And I will at this point yield the floor to the delegate of Panama, president of the Committee on Credentials. The floor is yours.
Buen día, señor presidente.
Morning, President. We're going to present our first report of the Committee on Credentials. Pursuant to Article 31 of the Rules of Procedure of the Directing Council, the Committee on Credentials, appointed during the first meeting and made up of the delegates of Panama, Paraguay, and St. Martin, met for the first time on December 20th, 2021 at 10:15 a.m. To serve as president, Panama was elected. The committee reviewed credentials that had been submitted to the director of the Bureau in keeping with Article 4 of the Rules of Procedure of the Council. The credentials from delegates of member states and participating states, associate members, and observer states are listed as follows, were duly and properly submitted. For this reason, the committee suggests that the council recognize their validity. We will now read the table with the credentials received. Member states and participating states, Antigua and Barbuda, Argentina, Belize, Bolivia, Brazil, Canada, Chile, Colombia, Costa Rica, Cuba, Dominica, the Dominican Republic, Ecuador, El Salvador, France, Grenada, Guatemala, Haiti, Honduras, Jamaica, Mexico, Nicaragua, Panama, Paraguay, Peru, St. Kitts and Nevis, St. Vincent and the Grenadines, Suriname, Trinidad and Tobago, United Kingdom, the United States of America, Venezuela, associate members, St. Martin, observer states, Portugal and Spain. The countries whose names were not mentioned must quickly send in their credentials to the email address credentials@paho.org. The committee will once again meet to review additional credentials to be received. We remind all delegates that any state that has not presented its credentials as required would be unable to vote. This is signed by Thais Noriega, delegate from Panama, president from Panama, Lourdes Jara, delegate from Paraguay, and Omar Otley, delegate from St. Martin. Thank you, Mr. President.
For that report, are there any objections to the report? I see Guyana. I recognize the delegate from Guyana.
His name was not on the list. I am aware that we have sent in our credentials, but we will follow up to ensure that our credentials are in. Thank you.
Thank you very much for that intervention. We will also follow up on this side to recognize, to clarify that omission. Okay, so we move on now to the next item, which would be item 2.5, having completed item 2.4. And item 2.5 is the adoption of the agenda. I would like to bring document CD 59-1 to the attention of the council. I now yield the floor to the secretary to present the item and the statutory provisions concerning this item. Madam Secretary.
Thank you very much, Mr. President. Rule 2 states, notices of convocation together with the provisional agenda shall be sent to all members, associate members, and observer states not less than 60 days before the date fixed for the opening of the session, except in extraordinary circumstances. Rule 10 states, the council shall adopt its own agenda, and in doing so, may make such additions or modifications to the provisional agenda as it may wish, in accordance with these rules and as recommended by the General Committee. In accordance with Rule 10 of the Rules of Procedure, a provisional agenda, as the President has identified, document CD 559/1, as approved by the Executive Committee, was distributed to each of the members, associate members, and observer states of the organization. It is now incumbent upon the Council, under Rule 10 of its Rules of Procedure, to adopt its own agenda. It is important to note that due to the extraordinary and unprecedented circumstances presented by the COVID-19 pandemic, the proposed provisional agenda is limited to those agenda items that must be decided upon to ensure the organization's ability to properly discharge its functions, and to those related to the COVID-19 pandemic in the region of the Americas. The provisional agenda proposes that member states, participating states, and associate members are invited to submit written comments for those items under Section 8 of the agenda, matters for information, which relate to the final reports and the progress reports of policies, strategies, and plans of actions. These are items 8.6 to 8.17. Written comments received by the Secretariat during the 59th Directing Council will be reflected in the final report of the session. Thank you, Mr. President, and over back to you.
Thank you very much for that, Madam Secretary. I open the floor to the plenary for discussion and invite delegates to raise their hand in the electronic platform. And I would like to ask for support the moderator to manage the list of speakers.
Thank you very much, Mr. President. We will proceed to take note of the requests for the floor. Seeing none, Mr. President, we give the floor back to you.
Okay, very well. I think we're making good progress. And therefore, I declare this particular agenda item adopted. We will continue on item 2.5, adoption of the agenda. Let me bring to your attention now the preliminary program of meeting document CD 59 WP1 Rev 1. Madam Secretary, please present the proposal. Thank you.
Thank you. Thank you, Mr. President. As you say, we're drawing the council's attention to document CD 59/WP/1 Rev 1, the provisional program of meetings. As the council is invited to approve the program of meetings, again, CD 59/WP/1, the council will examine 23 items, including 13 proposed resolutions. The proposed hours of work for the council will be from 9:30 a.m. to 12:30 p.m. and from 2:30 p.m. to 5 p.m. This will be Monday, today, September 20th, to or through Thursday, the 23rd of September of this year. On Friday, September 24th, the council will meet from 9:30 to 9:30 a.m. to 12:30 p.m. And right after the end of the directing council, the 59th directing council, the 169th session of the executive committee will occur. In addition, a daily program will be posted on PAHO's website at the beginning of the afternoon and at the end of each day. Thank you again, Mr. President, and I return the floor to you.
I open the floor now to the plenary for discussion and invite delegates to raise their hand in the electronic platform. And as requested before, I will ask our moderator to manage these proceedings.
Thank you very much, Mr. President. We proceed again to take note of the request for the floor. Seeing none, Mr. President, come back to you.
Thank you very much. If there are no objections, I declare the preliminary program meeting adopted. Okay, so we will now proceed to item 3.1, annual report of the President of the Executive Committee. I would like to bring document CD 59-2 to the attention of the council and ask the President of the Executive Committee, Ms. Adriana Salazar, Head of International Health Affairs of Costa Rica, to present annual report.
Buenos días, señor presidente. Muchísimas gracias.
Very good morning, Mr. President. Thank you. As President of the Executive Committee, it is my pleasure to introduce the report on the activities carried out by the committee and its subcommittee on program budget and administration between September 2020 and September 2021. During that period, the committee held its 167th and 168th sessions. And the subcommittee, for its part, held its 15th session. Now, owing to the extraordinary, unprecedented circumstances presented by COVID-19, the sessions of the governing bodies in 2020 and 2021 were all held online using a video conferencing platform. At the current time, I will report only on those items examined by the Executive Committee that are not also on the agenda of this Directing Council, but on the other items as they are taken up by the Council. During the period in question, the members of the Executive Committee were the following: Barbados, Brazil, Costa Rica, Cuba, Ecuador, Haiti, Mexico, Suriname, and the United States of America. The Executive Committee held its 167th session on the 30th of September 2020, immediately following the 58th Directing Council. My country, Costa Rica, was elected to serve as president of the Executive Committee for the period going from September 2020 through to September 2021. Haiti was elected vice president and Ecuador rapporteur. During the 167th session, the Executive Committee elected Barbados and Mexico to serve on the Subcommittee on Program Budget and Administration and appointed the members of the Award Committee for the PAHO Award for Health Services Management and Leadership 2021. The committee also set the dates for the sessions of the governing bodies in 2021 and agreed on topics to be discussed during the year. During that same session, the Executive Committee discussed a number of items that would normally have been discussed during the 166th session of the Executive Committee in June 2020. The committee had in fact deferred those items at the time so it could focus solely on matters related to COVID-19 and on matters requiring decisions in order to ensure that the organization could properly discharge its functions during the pandemic. During its 167th session, the Executive Committee adopted 1 resolution and 9 decisions, which appear together with a summary of the deliberations on each item in the final report of the session. The relevant reference is document CAPS CE 167/FR. The Executive Committee held its 168th session from the 21st to the 25th of June of this year. At that time, the committee heard a report on the 15th session of the Subcommittee on Program Budget and Administration, which was held in March. All of the administrative, financial, programmatic, and personnel matters discussed by the subcommittee at its 15th session were subsequently discussed by the Executive Committee. A number of them are also on the agenda of this Directing Council. Details may be found in the final report of the subcommittee's 15th session, document SPBA 15/FR. Among other actions taken during the June session, the Executive Committee decided to approve the admission of the 1 non-state actor into official relations with PAHO and the continuation of official relations between PAHO and 9 non-state actors. It also appointed 1 new member to the PAHO Audit Committee. Under administrative and financial matters, the Executive Committee received an update on the status of the Master Capital Investment Fund and its various subfunds. Committee recommended that the Bureau conduct an evaluation of the lessons learned from the new ways of working which were adopted during the pandemic, in particular, their impact on workspace needs. The Executive Committee likewise reviewed a report on the Working Capital Fund. The committee was informed that as a result of unpaid assessed contributions amounting to $84.6 million, the Bureau has been obliged to use the entirety of the balance in the Working Capital Fund and also to borrow from other unrestricted resources. The Bureau also updated the Executive Committee on the status of the emergency loan from the revolving fund for access to vaccines to the regional revolving fund for strategic public health supplies, presented a proposal for the extension of the emergency loan facility. The executive committee agreed to extend the loan until the 31st of December 2023, or the date of a WHO declaring announcement the end of the pandemic, whichever comes first. At the same time, the committee emphasized the importance of ensuring the appropriate managerial, financial, and analytical controls to prevent any negative impact on the Bureau's ability to support member states participating in the revolving fund for access to vaccines. Now, as regards personnel matters, the executive committee reviewed and endorsed several amendments to the staff rules related to staff salaries and other benefits. It also confirmed the salaries of the director, deputy director, and assistant director. The committee was informed that the Bureau is implementing a new People Strategy 2.0, which is designed to optimize resource efficiency, identify and bridge skill gaps, and promote career development inter alia. Information was also provided on the personnel measures implemented and the lessons learned during the pandemic, such as the revision of the Bureau's teleworking policy. As is customary, the executive committee heard a statement by a representative of the PAHO WHO Staff Association, who highlighted the importance of achieving gender equity and creating professional opportunities for staff. She also underlined the importance of attracting and retaining personnel and the need to revamp the Respectful Workplace initiative to take into account the new ways of working introduced during the pandemic. Executive Committee thanked the staff for their dedication and their hard work during the pandemic and expressed support for the Staff Association's recommendations to align policies to reflect new telework realities, maintain workplace flexibilities in order to attract and retain staff, and promote gender equity as well as gender parity. At its 168th session, the Executive Committee proceeded to adopt 16 resolutions and 2 decisions. These appear, together with a summary of the presentations and discussions on each item, in the final report of the session, document CE 168/FR. Mr. President, this concludes this portion of my report. As I said earlier, I will be reporting on the other items considered by the Executive Committee as they are taken up by the Directing Council. Thank you very much, sir.
Thank you very much, Madam President of the Executive Committee. I will now open the floor to the plenary for discussions and invite delegates to raise their hand on the electronic platform for any questions or comments. And I will ask our moderator to manage this aspect of the proceedings.
Thank you very much, Mr. President. We will then take note of the requests for the floor during this agenda item. Seeing none, Mr. President.
Okay. All right. So we are moving quite speedily, an indication of agreement with the reports that are being placed on the table. I'll therefore ask Madam Director, Dr. Etienne, for any comments that she may want to advance at this time.
Thank you, Mr. President. I wish to thank the President of the Executive Committee for having directed so efficiently and effectively the Executive Committee, and to thank all the members of the Executive Committee and other member states for their participation and deliberations in the Executive Committee. We have been able to go over all of the resolutions and to ensure that they are in a state to be passed by the General Directing Council. My sincere thanks to all of you.
Madam Director. I want to thank also the President of the Executive Committee for the report and the members of the Executive Committee for their invaluable work, and to inform the Council that the discussions will be noted in the final report. Thank you again. We now move quickly to items 3.2, which is the annual report of the Director of the Pan American Center Bureau. I would like to bring documents CD 59/3 to the attention of the Council and ask the Director of the Pan American Center Bureau to present her annual report.
Thank you, Mr. President. President of the 59th Directing Council of the Pan American Health Organization, Honorable Dr. Christopher Tufton, Minister of Health and Wellness of Jamaica, distinguished delegates, honored guests, esteemed ladies and gentlemen. Once again, a very good morning to you all. It is indeed my distinct pleasure to present to you the 2021 annual report of the Director of the Pan American Health Organization, which covers the period 1st July 2020 through 30 June 2021. The theme of this report, working through the COVID-19 pandemic, was chosen to reflect the difficult times and unprecedented challenges through which we navigated to deliver our technical cooperation during these 12 months of the continuing global COVID-19 pandemic. I am happy to report that despite the immense hardship and complications, the organization's work continued undiminished, striving as always to fulfill PAHO's values of equity, excellence, solidarity, respect, and integrity within the overarching framework of Pan-Americanism. However, our satisfaction is tempered by the catastrophic health, social, and economic impacts of the COVID-19 pandemic and its causative agent, SARS-CoV-2, which has put at risk many of the gains made by the countries of the region of the Americas. Indeed, too many lives have been lost and continue to be lost. As of 30th June 2021, almost 72.5 million cases of COVID-19 had been recorded in the region of the Americas and represented at that time 40% of the total cases reported globally, with almost 2 million deaths, approximating 48% of total deaths worldwide. Of those persons who have survived COVID-19, many are suffering from long COVID, the full spectrum of which is still unfolding. Despite our best intentions and efforts, access to COVID-19 vaccines remains inequitable, and the uptake of the vaccine, even when available, has been suboptimal in many areas and among certain population groups due to vaccine hesitancy, as well as widespread misinformation, pervasive myths, and disinformation. This, coupled with weaknesses in surveillance for conditions such as acute flaccid paralysis, which aims to detect polio, overly stretched health services such as at hospitals and intensive care, gaps in health coverage for populations such as pregnant women, and reduced public health services such as routine immunization of children and screening of persons with NCDs, are causing many, including myself, to worry. There is a probable threat of the re-emergence of vaccine-preventable diseases, which had been previously eliminated in our region. The social consequences of the pandemic have been significant. Feelings of isolation, loneliness, frustration, and even anger are common. There have been increased reports of mental health problems, including among youth, and conflicts, including domestic violence. The path to recovery from the devastating economic consequences of this pandemic will be long, especially so for low and middle income countries. We have witnessed extensive job losses and layoffs as businesses closed and persons struggled to pay their bills and to support themselves and their families. And governments had to dig deeply into the public purse or acquire substantial loans to cover the costs of their pandemic responses. Many inequities were unmasked as health systems and social safety nets strained to cope. And even while we applauded our frontline workers, we often fell short of adjusting systems to better protect them now and into the future, and to adequately remunerate them. I must also express my personal disappointment at the fragmentation and inequity as countries sought to access vaccines in the quickest possible time. While some of the region's better resourced countries successfully procured and pre-positioned vaccines for their populations, the sharing of excess and unused doses has been less than optimal, especially in the face of rising deaths and severe illness in low-resource countries, and despite the clear evidence that no one is safe until all are safe. Notwithstanding these disheartening developments, I would like to reassure you that PAHO, consistent with its 120-year history of adaptation and self-reinvention to remain relevant, PAHO has refused to be deterred. Both PAHO member states and the Secretariat have demonstrated a boundless capacity for resilience in the face of such obstacles, and time again have sought to find opportunity amidst despair. In that vein, the Bureau adapted to the restrictions imposed by the pandemic and the associated responses, and continued its technical cooperation with member states, focusing on preparedness and response to the pandemic and other emergencies, while simultaneously addressing other priority areas. The annual report of the Director of PAHO summarizes our achievements, innovations, the challenges encountered, and the lessons learned as we look towards the future, confident in the ability of both the member states and the Secretariat to collaborate and work together for the health and well-being of our peoples and towards sustainable development of the region. This report, therefore, is a comprehensive one, diligently documenting for posterity the work of the organization during this extraordinary time. I would respectfully recommend it for your reading. However, in view of the virtual context of this meeting, I will only provide brief remarks indicating some of the highs and lows, as well as the new imperatives for technical cooperation based on your guidance and cooperation to continue our forward march in collaboration with all of our valued partners. In confronting the COVID-19 pandemic, we focus on the 10 pillars of the PAHO COVID-19 response strategy, which is closely aligned with the WHO COVID-19 Strategic Preparedness and Response Plan. Actions within the framework of these pillars with covered areas ranging from planning and financing to risk communication, laboratories and diagnostics, international travel and transport, strengthening of essential health services and systems, and vaccination were all coordinated by the Bureau's incident management support teams across all organization levels and programs in a coordinated manner. In reorienting health systems to the pandemic response, emphasis was placed on promoting the essential public health functions, strengthening of primary health care, advocating for pro-equity policies, and regaining momentum towards a goal of universal access to health and universal health coverage. The critical importance of efficient, effective action at the first level of care became more evident to enable health promotion and management of persons with mild COVID-19 in that setting, with referral of more severely ill patients to higher levels of care. We continued striving for fairer outcomes over the life course, taking cognizance of the increased vulnerabilities of women, mothers, children, adolescents, and older persons during the pandemic, and sounding the alarm on the particular impact of COVID-19 on pregnant women. Even as we worked intensely to enable equitable access to COVID-19 vaccines, the Bureau continued to promote and facilitate routine vaccinations in an effort to protect those gains that are already achieved through elimination and to avert an outbreak of a vaccine-preventable disease such as poliomyelitis. Under the theme, Vaccines Bring Us Closer, the annual Vaccination Week in the Americas was launched virtually with the participation of 45 countries and territories. Our wide-ranging efforts focus not only on the continuity of routine vaccinations, but also on counteracting the pervasive misinformation and disinformation surrounding vaccines in general and the COVID-19 vaccines in particular. The Bureau continued its technical cooperation in advancing the reduction and elimination of communicable diseases and environmental threats. We worked to strengthen national responses to HIV and other sexually transmitted infections, as well as to malaria, tuberculosis, and neglected infectious diseases, to maintain coverage and to reduce the risk of co-infection with COVID-19. We also enhanced countries' capacities to detect and prevent antimicrobial resistance. As a complement to those efforts, we advanced interventions related to water, sanitation, and hygiene, particularly to control the spread of COVID-19, and integrated environmental surveillance into our routine health surveillance systems within the general context of the pandemic. The Bureau also worked to ensure food safety and contributed to mitigating the impact of climate change, especially in the vulnerable small island development states of the Caribbean. The Bureau expended significant time, effort, and resources in promoting new perspectives on the prevention and control of non-communicable diseases, including mental, neurological, and substance use disorders, in the face of overwhelming evidence of worse COVID-19 related outcomes in persons living with these conditions. We assessed and piloted WHO emergency NCD kits, which provide essential medicines and diagnostic supplies in selected countries, expanding the HEARTS, HEARTS program to prevent and manage cardiovascular disease, advanced interventions to address the main NCD risk factors, and focused on improving coordination, service delivery, capacity building, and communication for mental health and psychosocial support. In light of the ongoing COVID-19 related restrictions, the Bureau continued building on pandemic-inspired innovations for digital transformation and decision-making in health. In this regard, we advise countries on how to adopt or adapt information technologies to more effectively enable their responses to COVID-19. We monitored social inequalities and facilitated research to advance health equity. We supported countries in translating knowledge into action, disseminated information widely via active distribution lists, searchable platforms, and other modalities. And we implemented knowledge management strategies. Lessons learned from the Bureau's Information Systems for Health initiative and our publications in the Pan American Journal of Public Health played important roles in these efforts, as did our IRIS, which is the Bureau's digital library. In fulfillment of PAHO's values, the Bureau's effort in enhancing equity and human rights-based approaches did not falter. We accelerated work to develop health equity indicators and made recommendations for reducing inequities. We assessed the implementation of the PAHO gender policy and conducted analysis to document gender-related differentials in the impact of the COVID-19 pandemic. We also ensured the meaningful participation of Indigenous peoples and Afro-descendant populations in discussions of their needs and their rights, particularly within the context of the pandemic, and provided guidance on addressing the health of migrants in the current situation. PAHO is a learning organization with a long-standing culture of continuous quality improvement. The Bureau's institutional strengthening interventions supported the enhanced performance of the enabling functions for technical cooperation and for rapid quality responses to the evolving pandemic. We created organizational development interventions to guide institutional improvements. We took actions to protect our greatest asset, which is our human resources, adjusted our planning and budgeted to manage the evolving situation, particularly the financial aspect, constantly ensuring prudent management of our limited finances, establish new partnerships and alliances while strengthening traditional ones. We mobilized resources for the pandemic response, enabled uninterrupted functioning of our governing bodies, enhanced our information technology and communications, while paying close attention to cybersecurity. We improved our infrastructure where needed and as appropriate, and ensured ethical and transparent operations within PAHO's constitutionality, which was determined by our legal frameworks. Amidst all of these efforts, the Bureau never lost sight of its raison d'etre, maintaining its country focus and ensuring that technical cooperation, whether undertaken at regional, sub-regional, or country level, benefited the health of the peoples of the region. We ensured that the work on the pandemic did not eclipse our responsibilities to advance our commitments to the priority outcomes in the biennial program budget, the Strategic Health Agenda for the Americas, SHA, and our other mandates necessary for sustainable national development. Of course, we have faced many challenges. Among them, the apparent misunderstanding by many of who we are and what we do, constrained finances, gaps in national resources for effective performance of the essential public health functions, including human resources for health and health data disaggregated by equity stratifiers. And not least, the infodemic, characterized by misinformation and disinformation spread particularly on social media. We have also taken note of the several lessons learned, including the need for improvements in communications that target a multiplicity of different audiences, the importance of strengthening integration of the organization's cross-cutting themes of gender, ethnicity, equity, and human rights into all aspects of its work, the critical nature of resilient health systems based on the primary healthcare approach, and utilizing integrated health services delivery networks to advance universal health. The value of networks that encompass all levels of the Bureau, partner organization, and countries. Also, the need for acceleration and equitable expansion of the use of virtual platforms and tools. Importantly, the need for digital transformation of the health sector using innovative technologies. The imperative need for building regional self-sufficiency in access to health technology, including medicines and vaccines, and the crucial importance of interprogrammatic, intersectoral, people-centered collaboration. Let me state that we have been and are still being tested by the pandemic and its far-reaching consequences. Today, we are witnessing greater number of cases in the region as compared to the same time last year. We are observing new surges and repeated waves of infections in countries in which restrictions and other public health measures have been relaxed and borders opened. The continued emergence of variants of concern, some with increased transmissibility and the potential for increasing severity of disease, or even reducing or negating the efficacy of available vaccines, is indeed frightening. We must continue to promote vaccination, increase accessibility to vaccines, especially in resource-constrained settings, and for persons in conditions of vulnerability, and observe the recommended public health measures. The emergence and spread of SARS-CoV-2 variants has placed us all at risk. And I want to repeat again, until everyone is safe, no one is safe. If nothing else, this pandemic has taught us that we are indeed our brother's keeper. As we embrace this age of digital interdependence and considering the urgent need to access critical data and strategic information at the right time, the right place, and format, we are pleased to announce the launch of two major platforms. Health in the Americas, our well-known flagship publication, that today brings us a key analysis supported by dynamic dashboards on potentially avoidable premature mortality in our region. And also the Core Indicators platform, a renewed virtual space that will be the key for supporting informed policies and decision-making processes that contains data sets with over 270 key health and health-related indicators for the region of the Americas. For those of you who will recall, I mentioned in 2017 at the previous Pan American Sanitary Conference, and let me quote, "We cannot wait 5 years to present data in public health," unquote. Quality data can save lives, and this is something that we all need to understand and support. And this is why this week we will also pass two important resolutions related to digital transformation and health data science. Distinguished ministers and delegates, I have every confidence that we, the PAHO member states with the Secretariat and partners, will continue to rise to the occasion, learning from the lessons of the COVID-19 pandemic and focusing even more on the following: building resilient health systems for universal health with primary health care, a life course approach, and social protection as critical and indispensable components. 2, assuring social inclusion that meaningfully engages persons in conditions of vulnerability and puts them at the center of health policies, plans, and programs. 3, addressing explicitly the social, economic, environmental, commercial, and other determinants of health with promotion of and support for multi-sectoral, whole of society, whole of government, health in all policies approaches. 5, assuring equity and rights-based interventions that reduce inequities and contribute to the progressive realization of the right to health and other human rights. 6, harnessing the region's capacities and potential to build self-sufficiency in health technology, including medicines and vaccines, through solidarity that results in regional public goods and equitable access for all of our member states. With progress in the health and development of the region's people at stake, we cannot but embrace the truism that failure is not an option. We must move forward together, working assiduously to ensure better and fairer health and development outcomes that leave no one behind. As we continue to toil to put this pandemic behind us, let us recapture our Pan-American spirit of solidarity, which has underpinned the region's greatest achievements to date. It is only together that we will overcome, because again, until all of us are safe, none of us is safe. Let me thank you, our member states and our valued partners, for your unstinting support and noteworthy collaboration over these grueling last 12 months, without which none of these achievements would have been possible. Finally, I wish to convey my sincerest thanks and appreciation to the entire Secretariat team for their selfless dedication, their tenacious commitment, their creative adaptability, and boundless resilience, without which our mission would not be possible. Together, we will overcome. We have got this. Thank you.
Thank you very much, Madam Director, for that very timely, very comprehensive, and very important report and intervention. And I would like to also, on behalf of delegates, colleagues, express our appreciation to you for your efforts, for your leadership in these very challenging times. I now open the floor to the plenary for discussion and invite members to use the electronic platform to raise their hand, and will ask our moderator to manage this section of the proceedings.
Thank you very much, Mr. President. I would like to take the opportunity to remind member states that precedence will be given to member states, participating states, associate states, and observer states, followed by international governmental organizations participating in the meeting, and followed by non-state actors in official relations with PAHO. We will then take note of the request for the floor. I see Honduras, followed by Ecuador. Honduras, you have the floor.
Buenos días, señor presidente.
Good morning, Mr. Chairman. Good morning, colleagues, honorable members of the Directing Council, dear Dr. Carissa Etienne, Director of the Pan American Health Organization. On behalf of the government and people of Honduras, I thank you for this very thorough report. Without a doubt, we do agree with you that it's not an exaggeration to assert that this period has been the most difficult one for the Pan American Health Organization and for the World Health Organization, as well as for countries throughout the world. The topic of this report, Madam Director, continue working to overcome the COVID-19 pandemic, could not be more opportune for PAHO and for all of us, each one of the countries that make up this noble organization. Joining efforts in a joint way, expressing solidarity, will be the only way for us to more swiftly overcome the pandemic. And PAHO does indeed play a very important role for us to achieve that. The PAHO's role as a facilitator, given its technical capacity and a catalyzer for the technical and financial resources is key. I would like to underscore in this report the importance and the value that the financial and technical contribution that PAHO has made to our country, especially in response to healthcare emergencies during the COVID-19 pandemic. Now, revamping healthcare systems in response to the pandemic, that guide was helpful, as well as collaboration to maintain resilience of healthcare services, generally speaking, for the whole society, including mental health, non-communicable diseases, which became a risk, the most serious risk factor given COVID-19, maternal mortality risk, which rose owing to the pandemic and other important matters. I would be remiss if I concluded without thanking PAHO for all the support it provided Honduras in the crisis that we have gone through in 2019 throughout our country, be it with dengue, weather events, the COVID-19 pandemic. At all time, we received technical and financial support from PAHO and the WHO. I would underscore the support that we received from COVAX and the revolving fund for vaccines, which has made it possible for us to deliver those vaccines that were donated to our country. That made it possible for us to establish a mass vaccination program, which will make it possible for us to apply 5 million doses, which reaches a large percentage of our population. Over 1 million people have received a complete scheme of vaccines, which represents 28% of the entire population. I would like to thank donating countries, as well as for the, with that, we have consolidated the bilateral purchase of vaccines. US, Spain, Israel, El Salvador, the Dominican Republic, and Mexico all assisted us, as well as all those countries that finance the COVAX mechanism. I would conclude by reiterating our thanks to the organization and our solidarity to all member states of PAHO. Thank you very much and have a good morning. I thank the delegation of Honduras. We give the floor to Ecuador, followed by the US. Good afternoon. Your Excellency of the President of the 59th Directing Council of the Pan American Organization, Minister of Jamaica, Dr. Christopher Tupton, Dr. Carissa Etienne, the Madam Director of the Pan American Health Organization, ministers and health secretaries of member states, ladies and gentlemen. I would like to start by congratulating you, Mr. Chairman, for being appointed to the chairmanship, which means that all of the countries are very well represented by you. It's an honor for me as Vice President of the Medical Association in Ecuador. These venues enable us to work in this regional effort to set forth the future of health for the region. We should recognize the work done by the Pan American Health Organization in response to the COVID-19 pandemic throughout the region. This unprecedented historical event has taught us a lesson that only unity, ethics, and sustainability and resilience will enable us to move forward. The current health care system in Ecuador resulted from a failed administrative system that was non-transparent in its use of resources, exacerbated by the impact of the pandemic. Our intervention plan entails an overhaul of our healthcare system, starting with technical planning, as well as building on successful experiences from friendly countries and making use of technologies. With this, we will build an effective, universal, quality, and transparent healthcare system with a focus on changing our curative model to a preventive one that's focused on people, especially the most vulnerable people. Among the initiatives that we are undertaking, we have the fight against chronic child malnutrition, healthy living, potable water, better health infrastructure, also sanitation and waste management, and also encouraging the participation of all walks of society. With this new focus and with the commitment that we have taken on, we have put together the national vaccination program. That's 9 million people in 10 days, and that we are proud to have established that ambitious goal and overcome it or gone beyond it. This is a goal that shows that together we can all achieve a similar goal. To conclude, we make a call to the members of this organization to regional unity, to redouble efforts, to continue transforming healthcare, seeking out innovative managerial models that will make it possible to collectively build public health that rises to the standards that our citizens deserve. Ladies and gentlemen.
Thank you very much to the delegation of Ecuador. We give the floor now to the delegate of the United States, followed by Canada.
Thank you, Mr. Moderator, and our congratulations to Jamaica as president of the 59th Directing Council. The United States takes this opportunity to thank Dr. Etienne for her invaluable leadership of this organization, especially during the pandemic. We're deeply grateful for the tireless efforts of PAHO's leadership team and staff to support the whole region in combating the COVID-19 crisis. We appreciate this comprehensive report, which outlines an impressive set of achievements and assistance to member states. The PAHO region has an impressive track record of cooperation and building on lessons learned from the hardships faced by it and member states. We must recommit to working more closely together as we continue our efforts to overcome COVID-19 and rebuild. Regional solidarity and PAHO's technical cooperation remain fundamental to improving preparedness and response and advancing health equity and the right to health for all people in the Americas. Next year, we celebrate 120 years since PAHO's founding. We look forward to strengthening our work together in the next 100 years. Thank you.
Thank you very much to the delegation of the United States. Canada, you have the floor, followed by Brazil.
Mr. President, Dr. Etienne, honorable ministers, distinguished delegates, good morning. Hola, bom dia et bonjour. Canada is pleased to participate in the 59th Directing Council of the Pan American Health Organization. Congratulations to you, Mr. President, on your election to preside over us for the next year. At the outset, we would like to take this opportunity to thank our fearless director and her entire PAHO team for their outstanding leadership and commitment to better health and well-being for our region, especially during this pandemic. And to Monica and many others in the Secretariat for your excellent work in planning yet another virtual PAHO meeting. This time last year, we came together to reflect on our region's collective approach to public health, while at the same time grappling with the COVID-19 pandemic. What a year it has been. Over the last 12 months, the region of the Americas has witnessed 44 million cases of COVID-19 infection and over 1 million deaths. During the same time period, we have also seen a distribution of over 900 million COVID vaccines across the Americas, with more to follow. In light of these both grim and hopeful statistics, the theme of the director's report, working through the COVID-19 pandemic, rings true for us all. I expect most, if not all, colleagues in this directing council will share my sentiment when I say, I am tired. The report notes that this last year has been the most challenging ever encountered by PAHO. We should take a moment to express appreciation for the camaraderie, partnership we have felt, and also our gratitude to all the frontline health and care workers who continue to risk their lives every day in the fight against the pandemic. The pandemic has underscored the critical value of multilateral organizations like WHO and PAHO. It has also shown us that the important strides in the governance and operation of PAHO we have all been pursuing over the number of years has borne fruit. Unfortunately, we also continue to see significant hiccups in financial support to the organization by some member states. But now we're in a strategic, even pivotal moment for global health. We need to seize this moment and ensure sustained and consistent financing for PAHO's work accompanies the improvements in its governing. Madam Director, you have noted many times before that this organization belongs to all of us. This means that we rely on one another to continue making PAHO a strong organization for the future. In light of the current global health sustainable financing discussions, we must bear in mind that this requires a commitment from us all. Mr. President and colleagues, Canada is pleased to note the report highlights the region's critical participation in global discussions around the COVID-19 response. Canada appreciates the role played by our US colleagues on the WHO member state working group on strengthening WHO preparedness and response. Clearly, our regional representation and diverse experiences throughout the pandemic response can contribute to the international debate on strengthening global health architecture and the necessary sustainable financing to support it. The World Health Assembly special session later this fall will be a crucial milestone in this effort, and we look forward to actively participating there. Our region has a lot to offer in regards to lessons learned and best practices in preparing for and responding to public health emergencies. For example, we have significant experience in eliminating vaccine preventable diseases, such as polio, rubella, measles, and tetanus. Applying this expertise during the pandemic, reaching rural, remote, and northern communities with treatments and vaccines, countering misinformation, and fostering public trust in our national public health authorities are all areas that are critical to strengthening preparedness and response. We should champion these PAHO methods globally. At the same time, Madam Director, your report also correctly highlights more sobering realities, beginning with the fact that our region is one of the most health inequitable in the world. The pandemic has brought to light what we have known for so long. Health equity must be at the forefront of preparedness, response, and recovery. This means strengthening comprehensive, resilient, and equity-based health systems that protect everyone, including priority populations living in vulnerable situations. Canada recognizes PAHO's efforts to address heightened vulnerabilities experienced by women, mothers, children, adolescents, and older persons throughout the pandemic, and for striving to achieve equitable health outcomes and access to healthcare as a core component of its response. Efforts to address wide-ranging secondary impacts that have intensified throughout the last year, including poor mental health outcomes, are the only ways we will recover stronger. To this end, let's continue to work together to build evidence through surveillance and research in order to address the social, economic, political, and environmental determinants of health. We also appreciate PAHO's efforts this year to focus on strategic policy issues that will be critical for a post-COVID-19 recovery. This has been a hard year, yet with hardship comes hope, and with hope comes a vision for a better future. Our region has a lot to bring to the table, and it is our responsibility to contribute to these discussions as they will inevitably impact the future of health in the Americas. Merci. Thank you, Mr. President.
We would like to thank Canada for the intervention. We give now the floor to Brazil, followed by Barbados.
Senhora diretora da organização.
Madam Director of the Pan American Health Organization, Dr. Kavisa Etienne, colleagues, fellow ministers, and everyone in attendance. It's a pleasure to me to speak at the 59th Directing Council of PAHO, a period that was opened with this report. Rather, this was a very difficult time for the Americas and for the whole world as we face the biggest public health challenge in modern history. I would like to share with you the meaningful results that Brazil achieved. The health ministry concluded on the last 15th of the month, sending vaccines to vaccinate with the first dose more than 158 million Brazilians over 18 years of age. By September 15th, we had already vaccinated with the first dose more than 139 million Brazilian citizens. Overall, Brazil has already applied more than 214 million doses of the vaccine against COVID-19 and distributed more than 265 million doses. That means that now 87% of the adult population has been vaccinated with the first dose. 40% of the adult population is completely vaccinated. Now, as we move forward with our vaccination program, together with mass testing, it was possible for us to bring down by more than 60% cases of COVID as well as deaths over the last 2 months. Ladies and gentlemen, to overcome this current pandemic, we need to move forward with global vaccinations. And so we share in WHO's and PAHO's consideration that it's urgent for us to expand and to decentralize the production of vaccines, medications, and other health technologies. Thanks to a diversified strategy of access to vaccines, Brazil will, in short order, go from being an importer to an exporter of COVID-19 vaccines. Our economic industrial complex in health has the productive capacity, the technical capability, a safe regulatory environment, and vast experience to serve as a regional hub for the production of healthcare products for Latin America and the Caribbean. We would like to continue working hand in hand with PAHO, which has 120 years of experience in promoting strong, inclusive, resilient healthcare systems. And I'm certain that throughout the work that we will do this week, we will be able to focus our efforts on strengthening our capacities of response and readiness for health emergencies. We need to encourage together, foster together, that is PAHO and all of its member states, international examples of cooperation for all countries of the region to be able to overcome this unprecedented health crisis. Thank you very much.
Thank you, Brazil, for your intervention. We would now give the floor to Barbados, followed by Mexico.
Thank you, Mr. President. Let me first of all congratulate Jamaica for assuming the role of president of our executive committee for the coming year. Best wishes to you. I would like to thank you, Madam Director, for a most comprehensive and outstanding report, which is indicative of the commitment and the dedication of your entire team and under your astute leadership. The report clearly reflects the effort taken to provide us with quality and timely service, not only during the pandemic, but even in spite of the pandemic. I extend sincerest gratitude on behalf of the government and people of Barbados, and also on behalf of my CARICOM colleagues who may not get the opportunity to so express today. Thank you very much for a job. Very well done.
Thank you very much, Barbados, for your intervention. We have Mexico, followed by Cuba.
Muchas gracias, señor
I
presidente.
thank you very much, Mr. President. Distinguished representatives at this directing council, esteemed Dr. Etienne, please receive from Dr. Jorge Alcocer, the Minister of Health of Mexico, a warm greeting. I speak in his stead at this important meeting, and let me begin by thanking all of you joined here at this 59th Directing Council, following a second year running in the use of these virtual tools. We understand, of course, that we can only hope that in short order and as soon as possible, we will resume meeting face-to-face, because as useful as technology is, nothing beats close contact. Let me address particularly to Dr. Etienne that, as she well knows, the fact that a new pathogen has infected our vital system has put us all in an incredibly delicate situation. It has questioned the stability of our primary health care program, as we agreed 40 years ago in Alma Ata. But we have come together, and we're pleased that the measures we have taken have meant that we were not overwhelmed. We in Mexico have worked on mitigation and contention, particularly with a virtual complete lockdown in a week of healthy distancing in order to save lives. And that was the slogan: information saves lives. We published open nominal data anonymously to the benefit of more than 9 million persons who have been helped, as well as thousands of persons who day to day have intervened to better master the situation. Naturally, we have also worked very closely with our brothers and sisters in the region, and that is why public health trained a number of lab personnel in Latin America on our basis of SARS-2. And we also have worked on the basis of COVID-19 measures that have certainly been supported by WHO as a good response to the pandemic. And we are very much standing for COVAX as a means to fulfilling its raison d'etre and helping us get over this terrible challenge. More than 95 million doses of Mexico have been administered in Mexico. That puts us at about 69% of the population above 18 years old. We have millions of others to vaccinate the rest of the population. We're trying to be operating in a solidarity spirit with our friends in the region. We have handed over more than 2 million doses abroad, and to that end, we have especially been grateful to our next border neighbor, the US, who has handed us over more than 2 million in order to allow us in turn to beef up the Pan-Americanism and the genuine solidarity that characterizes our region. But let's not forget that COVID is not the only threat on the block. There are numbers of other dangers that have been there and continue to be there. We're working on clearer food labeling systems, such as Chile and Peru have established, implemented, of course, on the basis of lessons learned there. This is our first program on smart food labeling under the aegis of WHO. And we think that puts us in a very good position to exchange experience, for instance, with the UK, and hope that others will jump on board this new labeling system so that people can benefit. It is critically important that we work against the upward creep of obesity, changing our habits little by little. We have got to change our epidemic profile. And those countries who aren't yet struggling with that particular gorilla in the public health atmosphere, that is obesity, can take note and guard against it. There are three elements here. I want to say the Mexican public health system has been revamped. 2, we are beefing up our support to the PSB for better accountability. And 3, an increased willingness to share our experiences in public health. Those are the 3 points I would leave you with. Thanks very much.
And we yield the floor now to the delegate of Cuba.
Doctora Carissa Etienne,
Dr. Carissa Etienne, and Mr. President of this Directing Council, esteemed colleagues. Let me begin by sincerely applauding Dr. Etienne for her excellent presentation to us, which reflects the excellency of her stewardship over this time. We know very well how terribly difficult this period has been, with repercussions that are hard to gauge in all of our public health systems. From March of 2020, we revamped our action in order to better control the virus. The work of our professionals and scientists and our technological support has allowed us to include in our arsenal 3 different medications that have helped us, and this includes anti-inflammatories and elements to better diagnose. There are 3 vaccines that have been approved to face this emergency, and we have also launched a process to put before the WHO a better knowledge of what we're doing on an emergency basis. From the start, our position here has been dealing basically with 8,000 persons, and we have tried to face the Delta variant that is so highly contagious that is now affecting us throughout the country. To this stark reality, we have measures being taken, and we see, alas, that the embargo of the United States, unbelievably, has become even tighter during this pandemic where possible. But Cuba has not in any way dropped its guard and is doing what it can to share with you what we're doing. Back in May, we launched a vaccine campaign so that kids above 2 years and above now have had their first dose. 49% now have the second dose, and another important percentage have the 3. We would hope that before 2021 is done, we will have the entire population vaccinated. We would also say that we hope to be the first country to have fully immunized the most vulnerable groups. Ladies and gentlemen, solidarity and cooperation must stand. We've known this even before the pandemic struck. But in these very difficult times, Cuba has kept its presence in more than 59 countries to help the health situations there. When Cuban professionals have added more than 28,000 collaborators who had served so much and so unstintingly internationally before the pandemic, it speaks a lot about our ongoing principles in this regard. We thank WHO and we thank PAHO most especially for this stalwart and essential support. Dear friends, solidarity is the way to go. There is none other. We need to meet these challenges, and so we especially thank all the health workers anywhere in the world who are on those front lines and who make such a distance. Wherever each one of you is, know Cuba applauds you. Thank you very much.
Would like to thank Cuba for that intervention. And before proceeding, I yield the floor back to the President for an announcement.
Thank you very much for that, and thank you to those who made their presentations, their contribution, very important contribution. At this time, given the time, we are going to suspend items 3.2 until after the lunch break, which will be, we will have up until 2:30 p.m. when we resume here in this session and complete the session. At that point, you will hear Dr. Etienne, our director, respond to the comments or questions that have been raised. And before her, we will complete those delegates who will have additional contributions to make. So we will suspend now, but before that, I would like to ask Mr. David Splits to give us directions around a photo session that we will take just after the break. Mr. Splits?
Okay, yes. I would ask Harold, please, if you could turn off the cameras for the clock and what's called the video that we show. That way in gallery, I only have, okay, perfect. So all of the delegates that have to be on camera, can you please turn on your cameras? We're going to do a screenshot, where this is going to be our virtual group photo for the session, for the Directing Council 59. Por favor, si pueden encender sus cámaras, vamos a tomar la foto de grupo del Consejo Directivo 59. Gracias.
We're about to take the group photo for this Directing Council 59.
Okay, please look at the camera. Por favor, miren a la cámara. 1, 2, 3. Okay, just a second. Un momento. Okay. Okay, I believe I got everybody. Thank you very much. Muchas gracias. Creo que saqué foto a todos.
Okay, thank you very much. So we break until 2:30. Have a good lunch. Thank you.
Americas have been hit hard by COVID-19. In March 2021, after intense preparations, countries were ready to introduce COVID-19 vaccines with the help of PAHO. When the first vaccines from the COVAX facility, PAHO's revolving fund delivered them to the region. Here's what it took to get there. For decades, PAHO has worked with countries in the Americas to achieve their immunization goals with a lifelong approach and strong adult immunization services, making it the first region in the world to eradicate smallpox, be declared polio-free, and eliminate other vaccine-preventable diseases like rubella. PAHO helped to analyze and review vaccination plans and consolidate demand to allow all countries to purchase vaccines at affordable prices. Throughout the COVID-19 pandemic, PAHO has supported COVAX, aiming for equitable access to COVID-19 vaccine doses in the Americas. Because we are not safe until everyone is safe.
Hello, world. My name is Mia, and I am the first digital worker in the Pan American Health Organization. I am a proud procurement technician. I have been looking forward to working at PAHO. I started my job on Monday, March 29th, 2021. On my first day of work, I supported buyers by processing the repetitive parts of purchase orders for strategic products, including COVID-19 vaccines, under the COVAX Initiative for the Americas. I'm available 24 hours a day, 7 days a week. I am happy to contribute to the rapid purchase of vaccines for all the countries in the region. I look forward to working with you. Thank you very much.
Bonjour, je m'appelle Max. Je suis un technicien logistique virtuel pour le département de la gestion des achats et des approvisionnements de l'EPS Pro. Mon rôle est de traiter les commandes des fournitures et des vaccins relatives à Covid-19, aider à automatiser les achats soulage mes collègues, humain. Ceci leur permet de se concentrer sur d'autres tâches essentielles contribuant à la riposte mondiale à la pandémie. Je peux numériser les informations, traiter les informations d'expédition, remplir les formulaires d'expédition et suivre les numéros d'expédition, les vols, les transports, les transporteurs. Le nombre total d'expéditions et plus encore. Je suis disponible 24 heures sur 24 et 365 jours par an, car les envois peuvent arriver dans les pays n'importe quel jour ou à n'importe quelle heure. Merci Paro de m'avoir intégré à l'équipe.
I am.
We are.
All of us.
Together.
This is who we are.
Our humanity. The hopes we share.
The struggles we face.
The stories that define us.
Individually, collectively, universally.
Every person.
Family.
Community.
We are happier when we have each other.
Healthier when we stand together.
Every one of us matters.
No one should be left behind.
We all have the same fundamental right
To health and happiness.
To the care we need.
Wherever we live.
Whatever we have or do not have.
Regardless of age,
Race.
language,
culture, or circumstance.
This is our mission.
We stand together with all people.
in every community, every country, throughout the hemisphere.
Because we are healthier.
Together.
We are the Pan American Health Organization, working for health for everyone, everywhere.
Bonjour, je m'appelle Mia et je suis la première travailleuse numérique de l'Organisation panaméricaine de la santé. Je suis technicienne en achat et lors de mon premier jour de travail, j'ai accompagné les acheteurs en traitant les parties répétitives des commandes d'achat de produits stratégiques, dont les vaccins Covid-19, dans le cadre de l'initiative COVAX pour les Amériques. Je travaille 24 heures sur 24, 7 jours sur 7. Je suis heureuse de travailler à l'OPS car je contribue à l'achat rapide et efficace de vaccins pour tous les pays de la région. Merci beaucoup de m'avoir reçu et de me permettre de travailler avec vous.
The Americas have been hit hard by COVID-19. In March 2021, after intense preparations, countries were ready to introduce COVID-19 vaccines with the help of PAHO. When the first vaccines from the COVAX facility became available, PAHO's revolving fund delivered them to the region. Here's what it took to get there. For decades, PAHO has worked with countries in the Americas to achieve their immunization goals with a lifelong approach and strong adult immunization services, making it the first region in the world to eradicate smallpox, be declared polio-free, and eliminate other vaccine-preventable diseases like rubella. PAHO helped to analyze and review vaccination plans and consolidate demand to allow all countries to purchase vaccines at affordable prices. Throughout the COVID-19 pandemic, PAHO has supported COVAX, aiming for equitable access to COVID-19 vaccine doses in the Americas. Because we are not safe until everyone is safe.
Hola, soy Max, un técnico de logística virtual para el Departamento de Gestión de Adquisiciones y Suministros de la OPS. Mi función es procesar los pedidos relacionados con los suministros y las vacunas contra la COVID-19. Ayudar a automatizar las adquisiciones les quita una carga a mis colegas humanos, permitiéndoles enfocarse en otras tareas esenciales. Yo puedo digitalizar información, procesar la información de envíos, rellenar formularios de envío y rastrear números de envíos, vuelos, transportistas, número total de envíos y más. También puedo crear archivos de envío avanzados, cargar documentos de envío y completar la información del lote en las órdenes de compra. Estoy disponible las 24 horas, los 365 días del año, ya que los envíos pueden llegar a países en cualquier momento. Gracias, OPS, por hacerme parte del equipo.
Olá, mundo! Meu nome é Mia e sou a primeira trabalhadora digital da Organização Pan-Americana da Saúde. Eu sou uma técnica de compras e no meu primeiro dia de trabalho, apoiei os compradores processando as partes repetitivas dos pedidos de compra de produtos estratégicos, incluindo vacinas Covid-19 sob a iniciativa COVAX para as Américas. Trabalho 24 horas por dia, 7 dias por semana. Estou feliz por trabalhar na OPAS, pois contribuo para a compra rápida e eficaz de vacinas para todos os países da região. Muito obrigada por me receber e por me permitir trabalhar com você.
I am.
We are.
All of us.
Together.
This is who we are.
Our humanity, the hopes we share,
The struggles we face.
The stories that define us.
individually, collectively, universally.
Every person.
Family.
Community.
We are happier when we have each other.
Healthier when we stand together.
Every one of us matters.
No one should be left behind.
We all have the same fundamental right
To health and happiness,
To the care we need.
Wherever we live.
whatever we have or do not have.
Regardless of age,
Race.
Language.
culture, or circumstance.
This is our mission.
We stand together with all people
In every community, every country, throughout the hemisphere.
Because we are healthier.
together.
We are the Pan American Health Organization, working for health for everyone, everywhere.
virtual logistics technician for PAHO's Procurement and Supply Management Department, PRO. My role is to process orders relating to COVID-19 supplies and vaccines. Helping automate procurement takes the load off my human colleagues, enabling them to focus on other essential tasks contributing to the global pandemic response. I can digitize information, process shipping information, fill out shipping forms, and track shipping numbers, flights, carriers, total number of shipments, and more. I can also create advanced shipping notices, upload shipping documents, and fill out the batch information in purchase orders. I am available 24 hours a day and 365 days of the year, since shipments can arrive in countries at any day or time. Thank you, PAHO, for having me.
Hola mundo, mi nombre es Mía y soy la primera trabajadora digital de la Organización Panamericana de la Salud. Soy técnica de adquisiciones y en mi primer día de trabajo apoyé a los compradores procesando las partes repetitivas de las órdenes de compra de productos estratégicos, incluidas las vacunas COVID-19, bajo la iniciativa COVAX para las Américas. Trabajo las 24 horas del día, los 7 días de la semana. Estoy feliz de trabajar en la OPS, ya que contribuyo a la compra rápida y efectiva de vacunas para todos los países de la región. Muchísimas gracias por recibirme y por permitirme trabajar con ustedes.
The Americas have been hit hard by COVID-19. In March 2021, after intense preparations, countries were ready to introduce COVID-19 vaccines with the help of PAHO. When the first vaccines from the COVAX facility became available, PAHO's revolving fund delivered them to the region. Here's what it took to get there. For decades, PAHO has worked with countries in the Americas to achieve their immunization goals with a lifelong approach and strong adult immunization services, making it the first region in the world to eradicate smallpox, be declared polio-free, and eliminate other vaccine-preventable diseases like rubella. PAHO helped to analyze and review vaccination plans and consolidate demand to allow all countries to purchase vaccines at affordable prices. Throughout the COVID-19 pandemic, PAHO has supported COVAX, aiming for equitable access to COVID-19 vaccine doses in the Americas. Because we are not safe until everyone is safe.
Olá, eu sou o Max. Eu sou um técnico de logística virtual para o departamento de compras da OPAS. Minha função é processar os pedidos relacionados a suprimentos e vacinas no combate à Covid-19. Ajudar na automatização das aquisições para a OPAS tira uma grande carga de tarefas dos meus colegas humanos. Eu posso digitalizar informações, processar informações de envio, preencher formulários de envio e rastrear números de remessa, voos, transportadoras, número total de remessas e muito mais. Eu também posso criar notificações prévias de remessa, fazer o carregamento de dados sobre os documentos de uma remessa e preencher com informações necessárias para efetuar pedidos e compras. Obrigado, OPAS, por me receber.
The Americas have been hit hard by COVID-19. In March 2021, after intense preparations, countries were ready to introduce COVID-19 vaccines with the help of PAHO. When the first vaccines from the COVAX facility became available, PAHO's revolving fund delivered them to the region. Here's what it took to get there. For decades, PAHO has worked with countries in the Americas to achieve their immunization goals with a lifelong approach and strong adult immunization services, making it the first region in the world to eradicate smallpox, be declared polio-free, and eliminate other vaccine-preventable diseases like rubella. PAHO helped to analyze and review vaccination plans and consolidate demand to allow all countries to purchase vaccines at affordable prices. Throughout the COVID-19 pandemic, PAHO has supported COVAX, aiming for equitable access to COVID-19 vaccine doses in the Americas. Because we are not safe until everyone is safe.
Hello, world. My name is Mia, and I am the first digital worker in the Pan American Health Organization. I am a proud procurement technician. I have been looking forward to working at PAHO. I started my job on Monday, March 29th, 2021. On my first day of work, I supported buyers by processing the repetitive parts of purchase orders for strategic products, including COVID-19 vaccines, under the COVAX Initiative for the Americas. I'm available 24 hours a day, 7 days a week. I am happy to contribute to the rapid purchase of vaccines for all the countries in the region. I look forward to working with you. Thank you very much.
Bonjour, je m'appelle Max. Je suis un technicien logistique virtuel pour le département de la gestion des achats et des approvisionnements de l'OPS Pro. Mon rôle est de traiter les commandes des fournitures et des vaccins relatives à Covid-19. Aider à automatiser les achats soulage mes collègues humains. Ceci leur permet de se concentrer sur d'autres tâches essentielles contribuant à la riposte mondiale à la pandémie. Je peux numériser les informations, traiter les informations d'expédition, remplir les formulaires d'expédition et suivre les numéros d'expédition, les vols, les transports, les transporteurs, le nombre total d'expéditions et plus encore. Je suis disponible 24 heures sur 24 et 365 jours par an, car les envois peuvent arriver dans les pays n'importe quel jour ou à n'importe quelle heure. Merci Paro de m'avoir intégré à l'équipe.
I am.
We are.
All of us.
Together.
This is who we are.
Our humanity. The hopes we share.
The struggles we face.
The stories that define us.
Individually, collectively, universally.
Every person.
Family.
Community.
We are happier when we have each other.
Healthier when we stand together.
Every Every one of us matters.
No one should be left behind.
We all have the same fundamental right
To health and happiness,
To the care we need,
Wherever we live,
whatever we have or do not have.
regardless of age,
race,
language,
culture, or circumstance.
This is our mission.
We stand together with all people
in every community, every country, throughout the hemisphere.
Because we are healthier.
Together.
We are the Pan American Health Organization, working for health for everyone, everywhere.
Bonjour, je m'appelle Mia et je suis la première travailleuse numérique de l'Organisation panaméricaine de la santé. Je suis technicienne en achat et lors de mon premier jour de travail, j'ai accompagné les acheteurs en traitant les parties répétitives des commandes d'achat de produits stratégiques, dont les vaccins COVID-19, dans le cadre de l'initiative COVAX pour les Amériques. Je travaille 24 heures sur 24, 7 jours sur 7. Je suis heureuse de travailler à l'OPS car je contribue à l'achat rapide et efficace de vaccins pour tous les pays de la région. Merci beaucoup de m'avoir reçu et de me permettre de travailler avec vous.
The Americas have been hit hard by COVID-19. In March 2021, after intense preparations, countries were ready to introduce COVID-19 vaccines with the help of PAHO. When the first vaccines from the COVAX facility became available, PAHO's revolving fund delivered them to the region. Here's what it took to get there. For decades, PAHO has worked with countries in the Americas to achieve their immunization goals with a lifelong approach and strong adult immunization services, making it the first region in the world to eradicate smallpox, be declared polio-free, and eliminate other vaccine-preventable diseases like rubella. PAHO helped to analyze and review vaccination plans and consolidate demand to allow all countries to purchase vaccines at affordable prices. Throughout the COVID-19 pandemic, PAHO has supported COVAX, aiming for equitable access to COVID-19 vaccine doses in the Americas. Because we are not safe until everyone is safe.
Hola, soy Max, un técnico de logística virtual para el Departamento de Gestión de Adquisiciones y Suministros de la OPS. Mi función es procesar los pedidos relacionados con los suministros y las vacunas contra la COVID-19. Ayudar a automatizar las adquisiciones les quita una carga a mis colegas humanos, permitiéndoles enfocarse en otras tareas esenciales. Yo puedo digitalizar información, procesar la información de envíos, rellenar formularios de envío y rastrear números de envíos, vuelos, transportistas, número total de envíos y más. También puedo crear archivos de envío avanzados, cargar documentos de envío y completar la información del lote en las órdenes de compra. Estoy disponible las 24 horas, los 365 días del año, ya que los envíos pueden llegar a países en cualquier momento. Gracias, OPS, por hacerme parte del equipo.
Olá, mundo! Meu nome é Mia e sou a primeira trabalhadora digital da Organização Pan-Americana da Saúde. Eu sou uma técnica de compras e no meu primeiro dia de trabalho, apoiei os compradores processando as partes repetitivas.
The Americas have been hit hard by COVID-19. In March 2021, after intense preparations, countries were ready to introduce COVID-19 vaccines with the help of PAHO. When the first vaccines from the COVAX facility became available, PAHO's revolving fund delivered them to the region. Here's what it took to get there. For decades, PAHO has worked with countries in the Americas to achieve their immunization goals with a lifelong approach and strong adult immunization services, making it the first region in the world to eradicate smallpox, be declared polio-free, and eliminate other vaccine-preventable diseases like rubella. PAHO helped to analyze and review vaccination plans and consolidate demand to allow all countries to purchase vaccines at affordable prices. Throughout the COVID-19 pandemic, PAHO has supported COVAX, aiming for equitable access to COVID-19 vaccine doses in the Americas. Because we are not safe until everyone is safe.
Hello, world. My name is Mia, and I am the first digital worker in the Pan American Health Organization. I am a proud procurement technician. I have been looking forward to working at PAHO. I started my job on Monday, March 29th, 2021. On my first day of work, I supported buyers by processing the repetitive parts of purchase orders for strategic products, including COVID-19 vaccines, under the COVAX Initiative for the Americas. I'm available 24 hours a day, 7 days a week. I am happy to contribute to the rapid purchase of vaccines for all the countries in the region. I look forward to working with you. Thank you very much.
Bonjour, je m'appelle Max. Je suis un technicien logistique virtuel pour le département de la gestion des achats et des approvisionnements de l'OPS Pro. Mon rôle est de traiter les commandes des fournitures et des vaccins relatives à Covid-19. Aider à automatiser les achats soulage mes collègues humains. Ceci leur permet de se concentrer sur d'autres tâches essentielles contribuant à la riposte mondiale à la pandémie. Je peux numériser les informations, traiter les informations d'expédition, remplir les formulaires d'expédition et suivre les numéros d'expédition, les vols, les transports, les transporteurs, le nombre total d'expéditions et plus encore. Je suis disponible 24 heures sur 24 et 365 jours par an, car les envois peuvent arriver dans les pays n'importe quel jour ou à n'importe quelle heure. Merci Paro de m'avoir intégré à l'équipe.
I am.
We are.
All of us.
Together.
This is who we are.
Our humanity. The hopes we share.
The struggles we face.
The stories that define us.
Individually, collectively, universally.
Every person.
Family.
Community.
We are happier when we have each other.
Healthier when we stand together.
Every one of us matters.
No one should be left behind.
We all have the same fundamental right
To health and happiness.
To the care we need.
Wherever we live.
Whatever we have or do not have.
Regardless of age,
Race.
Language.
culture, or circumstance.
This is our mission.
We stand together with all people.
In every community, every country, throughout the hemisphere.
Because we are healthier.
together.
We are the Pan American Health Organization, working for health for everyone, everywhere.
Bonjour, je m'appelle Mia et je suis la première travailleuse numérique de l'Organisation panaméricaine de la santé. Je suis technicienne en achat et lors de mon premier jour de travail, j'ai accompagné les acheteurs en traitant les parties répétitives des commandes d'achat de produits stratégiques, dont les vaccins Covid-19, dans le cadre de l'initiative COVAX pour les Amériques. Je travaille 24 heures sur 24, 7 jours sur 7. Je suis heureuse de travailler à l'OPS car je contribue à l'achat rapide et efficace de vaccins pour tous les pays de la région. Merci beaucoup de m'avoir reçu et de me permettre de travailler avec vous.
The Americas have been hit hard by COVID-19. In March 2021, after intense preparations, countries were ready to introduce COVID-19 vaccines with the help of PAHO. When the first vaccines from the COVAX facility became available, PAHO's revolving fund delivered them to the region. Here's what it took to get there. For decades, PAHO has worked with countries in the Americas to achieve their immunization goals with a lifelong approach and strong adult immunization services, making it the first region in the world to eradicate smallpox, be declared polio-free, and eliminate other vaccine-preventable diseases like rubella. PAHO helped to analyze and review vaccination plans and consolidate demand to allow all countries to purchase vaccines at affordable prices. Throughout the COVID-19 pandemic, PAHO has supported COVAX, aiming for equitable access to COVID-19 vaccine doses in the Americas. Because we are not safe until everyone is safe.
Hola, soy Max, un técnico de logística virtual para el Departamento de Gestión de Adquisiciones y Suministros de la OPS. Mi función es procesar los pedidos relacionados con los suministros y las vacunas contra la COVID-19. Ayudar a automatizar las adquisiciones les quita una carga a mis colegas humanos, permitiéndoles enfocarse en otras tareas esenciales. Yo puedo digitalizar información, procesar la información de envíos, rellenar formularios de envío y rastrear números de envíos, vuelos, transportistas, número total de envíos y más. También puedo crear archivos de envío avanzados, cargar documentos de envío y completar la información del lote en las órdenes de compra. Estoy disponible las 24 horas, los 365 días del año, ya que los envíos pueden llegar a países en cualquier momento. Gracias OPS por hacerme parte del equipo.
Olá, mundo! Meu nome é Mia e sou a primeira trabalhadora digital da Organização Pan-Americana da Saúde. Eu sou uma técnica de compras e no meu primeiro dia de trabalho apoiei os compradores processando as partes repetitivas dos pedidos de compra de produtos estratégicos, incluindo vacinas Covid-19 sob a iniciativa COVAX para as Américas. Trabalho 24 horas por dia, 7 dias por semana. Estou feliz por trabalhar na OPAS, pois contribuo para a compra rápida e eficaz de vacinas para todos os países da região. Muito obrigada por me receber e por me permitir trabalhar com você.
I am.
We are.
All of us.
Together.
This is who we are.
Our humanity. The hopes we share.
The struggles we face.
The stories that define us.
Individually, collectively, universally.
Every person,
family,
Community.
We are happier when we have each other.
Healthier when we stand together.
every one of us matters.
No one should be left behind.
We all have the same fundamental right
To health and happiness.
To the care we need.
Wherever we live.
Whatever we have or do not have.
Regardless of age,
Race.
Language.
culture, or circumstance.
This is our mission.
We stand together with all people
In every community, every country, throughout the hemisphere.
Because we are healthier.
together.
We are the Pan American Health Organization, working for health for everyone, everywhere.
Logistics Technician for PAHO's Procurement and Supply Management Department, PRO. My role is to process orders relating to COVID-19 supplies and vaccines. Helping automate procurement takes a load off my human colleagues, enabling them to focus on other essential tasks contributing to the global pandemic response. I can digitize information, process shipping information, fill out shipping forms, and track shipping numbers, flights, carriers, total number of shipments, and more. I can also create advanced shipping notices, upload shipping documents, and fill out the batch information in purchase orders. I am available 24 hours a day and 365 days of the year, since shipments can arrive in countries at any day or time. Thank you, PAHO, for having me.
Hola mundo, mi nombre es Mía y soy la primera trabajadora digital de la Organización Panamericana de la Salud. Soy técnica de adquisiciones y en mi primer día de trabajo apoyé a los compradores procesando las partes repetitivas de las órdenes de compra de productos estratégicos, incluidas las vacunas COVID-19, bajo la iniciativa COVAX para las Américas. Trabajo las 24 horas del día, los 7 días de la semana. Estoy feliz de trabajar en la OPS, ya que contribuyo a la compra rápida y efectiva de vacunas para todos los países de la región. Muchísimas gracias por recibirme y por permitirme trabajar con ustedes.
the Americas have been hit hard by COVID-19. In March 2021, after intense preparations, countries were ready to introduce COVID-19 vaccines with the help of PAHO. When the first vaccines from the COVAX facility became available, PAHO's revolving fund delivered them to the region. Here's what it took to get there. For decades, PAHO has worked with countries in the Americas to achieve their immunization goals with a lifelong approach and strong adult immunization services, making it the first region in the world to eradicate smallpox, be declared polio-free, and eliminate other vaccine-preventable diseases like rubella. PAHO helped to analyze and review vaccination plans and consolidate demand to allow all countries to purchase vaccines at affordable prices. Throughout the COVID-19 pandemic, PAHO has supported COVAX, aiming for equitable access to COVID-19 vaccine doses in the Americas. Because we are not safe until everyone is safe.
Olá, eu sou o Max. Eu sou um técnico de logística virtual para o departamento de compras da OPAS. Minha função é processar os pedidos relacionados a suprimentos e vacinas no combate à Covid-19. Ajudar na automatização das aquisições para a OPAS tira uma grande carga de tarefas dos meus colegas humanos. Eu posso digitalizar informações, processar informações de envio, preencher formulários de envio e rastrear números de remessa, voos, transportadoras, número total de remessas e muito mais. Eu também posso criar notificações prévias de remessa, fazer o carregamento de dados sobre os documentos de uma remessa e preencher com informações necessárias para
help of PAHO. When the first vaccines from the COVAX facility became available, PAHO's revolving fund delivered them to the region. Here's what it took to get there. For decades, PAHO has worked with countries in the Americas to achieve their immunization goals with a lifelong approach and strong adult immunization services, making it the first region in the world to eradicate smallpox, be declared polio-free, and eliminate other vaccine-preventable diseases like rubella. PAHO helped to analyze and review vaccination plans and consolidate demand to allow all countries to purchase vaccines at affordable prices. Throughout the COVID-19 pandemic, PAHO has supported COVAX, aiming for equitable access to COVID-19 vaccine doses in the Americas. Because we are not safe until everyone is safe.
Hello, world. My name is Mia, and I am the first digital worker in the Pan American Health Organization. I am a proud procurement technician. I have been looking forward to working at PAHO. I started my job on Monday, March 29th, 2021. On my first day of work, I supported buyers by processing the repetitive parts of purchase orders for strategic products, including COVID-19 vaccines, under the COVAX Initiative for the Americas. I'm available 24 hours a day, 7 days a week. I am happy to contribute to the rapid purchase of vaccines for all the countries in the region. I look forward to working with you. Thank you very much.
Bonjour, je m'appelle Max. Je suis un technicien logistique virtuel pour le département de la gestion des achats et des approvisionnements de l'OPS Pro. Mon rôle est de traiter les commandes des fournitures et des vaccins relatives à Covid-19. Aider à automatiser les achats soulage mes collègues humains. Ceci leur permet de se concentrer sur d'autres tâches essentielles contribuant à la riposte mondiale à la pandémie. Je peux numériser les informations, traiter les informations d'expédition, remplir les formulaires d'expédition et suivre les numéros d'expédition, les vols, les transports, les transporteurs, le nombre total d'expéditions et plus encore. Je suis disponible 24 heures sur 24 et 365 jours par an, car les envois peuvent arriver dans les pays n'importe quel jour ou à n'importe quelle heure. Merci Paro de m'avoir intégré à l'équipe.
I am.
We are.
All of us.
Together.
This is who we are.
Our humanity. The hopes we share.
The struggles we face.
The stories that define us.
Individually, collectively, universally.
Every person,
family,
community,
We are happier when we have each other.
Healthier when we stand together.
Every one of us matters.
No one should be left behind.
the Americas have been hit hard by COVID-19. In March 2021, after intense preparations, countries were ready to introduce COVID-19 vaccines with the help of PAHO. When the first vaccines from the COVAX facility became available, PAHO's revolving fund delivered them to the region. Here's what it took to get there. For decades, PAHO has worked with countries in the Americas to achieve their immunization goals with a lifelong approach and strong adult immunization services, making it the first region in the world to eradicate smallpox, be declared polio-free, and eliminate other vaccine-preventable diseases like rubella. PAHO helped to analyze and review vaccination plans and consolidate demand to allow all countries to purchase vaccines at affordable prices. Throughout the COVID-19 pandemic, PAHO has supported COVAX, aiming for equitable access to COVID-19 vaccine doses in the Americas. Because we are not safe until everyone is safe.
Hello, world. My name is Mia, and I am the first digital worker in the Pan American Health Organization. I am a proud procurement technician. I have been looking forward to working at PAHO. I started my job on Monday, March 29th, 2021. On my first day of work, I supported buyers by processing the repetitive parts of purchase orders for strategic products, including COVID-19 vaccines, under the COVAX Initiative for the Americas. I'm available 24 hours a day, 7 days a week. I am happy to contribute to the rapid purchase of vaccines for all the countries in the region. I look forward to working with you. Thank you very much.
Bonjour, je m'appelle Max. Je suis un technicien logistique virtuel pour le département de la gestion des achats et des approvisionnements de l'OPS Pro. Mon rôle est de traiter les commandes des fournitures et des vaccins relatives à Covid-19, aider à automatiser les achats soulage mes collègues humain. Ceci leur permet de se concentrer sur d'autres tâches essentielles contribuant à la riposte mondiale à la pandémie. Je peux numériser les informations, traiter les informations d'expédition, remplir les formulaires d'expédition et suivre les numéros d'expédition, les vols, les transports, les transporteurs, le nombre total d'expéditions et plus encore. Je suis disponible 24 heures sur 24 et 365 jours par an, car les envois peuvent arriver dans les pays n'importe quel jour ou à n'importe quelle heure. Merci Paho de m'avoir intégré à l'équipe.
I am.
We are.
All of us.
Together.
This is who we are.
Our humanity. The hopes we share.
The struggles we face.
The stories that define us.
Individually, collectively, universally.
Every person.
Family.
Community.
We are happier when we have each other.
Healthier when we stand together.
Every one of us matters.
No one should be left behind.
We all have the same fundamental right
To health and happiness.
To the care we need.
Wherever we live.
Whatever we have or do not have.
Regardless of age,
Race.
language,
culture, or circumstance.
This is our mission.
We stand together with all people
in every community, every country, throughout the hemisphere.
Because we are healthier.
Together.
We are the Pan American Health Organization, working for health for everyone, everywhere.
Bonjour, je m'appelle Mia et je suis la première travailleuse numérique de l'Organisation panaméricaine de la santé. Je suis technicienne en achat et lors de mon premier jour de travail, j'ai accompagné les acheteurs en traitant les parties répétitives des commandes d'achat de produits stratégiques, dont les vaccins Covid-19, dans le cadre de l'initiative COVAX pour les Amériques. Je travaille 24 heures sur 24, 7 jours sur 7. Je suis heureuse de travailler à l'OPS car je contribue à l'achat rapide et efficace de vaccins pour tous les pays de la région. Merci beaucoup de m'avoir reçu et de me permettre de travailler avec vous.
The Americas have been hit hard by COVID-19. In March 2021, after intense preparations, countries were ready to introduce COVID-19 vaccines with the help of PAHO. When the first vaccines from the COVAX facility became available, PAHO's revolving fund delivered them to the region. Here's what it took to get there. For decades, PAHO has worked with countries in the Americas to achieve their immunization goals with a lifelong approach and strong adult immunization services, making it the first region in the world to eradicate smallpox, be declared polio-free, and eliminate other vaccine-preventable diseases like rubella. PAHO helped to analyze and review vaccination plans, and consolidate demand to allow all countries to purchase vaccines at affordable prices. Throughout the COVID-19 pandemic, PAHO has supported COVAX, aiming for equitable access to COVID-19 vaccine doses in the Americas. Because we are not safe until everyone is safe.
Hola, soy Max, un técnico de logística virtual para el Departamento de Gestión de Adquisiciones y Suministros de la OPS. Mi función es procesar los pedidos relacionados con los suministros y las vacunas contra la COVID-19. Ayudar a automatizar las adquisiciones les quita una carga a mis colegas humanos, permitiéndoles enfocarse en otras tareas esenciales. Yo puedo digitalizar información, procesar la información de envíos, rellenar formularios de envío y rastrear números de envíos, vuelos, transportistas, número total de envíos y más. También puedo crear archivos de envío avanzados, cargar documentos de envío y completar la información del lote en las órdenes de compra. Estoy disponible las 24 horas, los 365 días del año, ya que los envíos pueden llegar a países en cualquier momento. Gracias OPS por hacerme parte del equipo.
Olá, mundo! Meu nome é Mia e sou a primeira trabalhadora digital da Organização Pan-Americana da Saúde. Eu sou uma técnica de compras e no meu primeiro dia de trabalho apoiei os compradores processando as partes repetitivas dos pedidos de compra de produtos estratégicos, incluindo vacinas Covid-19 sob a iniciativa COVAX para as Américas. Trabalho 24 horas por dia, 7 dias por semana. Estou feliz por trabalhar na OPAS, pois contribuo para a compra rápida e eficaz de vacinas para todos os países da região. Muito obrigada por me receber e por me permitir trabalhar com você.
I am.
We are.
All of us.
Together.
This is who we are.
Our humanity. The hopes we share.
The struggles we face.
The stories that define us.
Individually, collectively, universally.
Every person,
family,
community.
We are happier when we have each other.
Healthier when we stand together.
Every one of us matters.
No one should be left behind.
We all have the same fundamental right
to health and happiness,
to the care we need,
wherever we live,
whatever we have or do not have,
regardless of age,
race,
language,
culture, or circumstance.
This is our mission.
We stand together with all people.
In every community, every country, throughout the hemisphere.
Because we are healthier.
Together.
We are the Pan American Health Organization, working for health for everyone, everywhere.
am Max, a virtual logistics technician for PAHO's Procurement and Supply Management Department Pro. My role is to process orders relating to COVID-19 supplies and vaccines. Helping automate procurement takes a load off my human colleagues, enabling them to focus on other essential tasks contributing to the global pandemic response. I can digitize information, process shipping information, fill out shipping forms, and track shipping numbers, flights, carriers, total number of shipments, and more. I can also create advanced shipping notices, upload shipping documents, and fill out the batch information in purchase orders. I am available 24 hours a day and 365 days of the year, since shipments can arrive in countries at any day or time. Thank you, PAHO, for having me.
Hola mundo, mi nombre es Mía y soy la primera trabajadora digital de la Organización Panamericana de la Salud. Soy técnica de adquisiciones y en mi primer día de trabajo apoyé a los compradores procesando las partes repetitivas de las órdenes de compra de productos estratégicos, incluidas las vacunas COVID-19, bajo la iniciativa COVAX para las Américas. Trabajo las 24 horas del día, los 7 días de la semana. Estoy feliz de trabajar en la OPS, ya que contribuyo a la compra rápida y efectiva de vacunas para todos los países de la región. Muchísimas gracias por recibirme y por permitirme trabajar con ustedes.
Americas have been hit hard by COVID-19. In March 2021, after intense preparations, countries were ready to introduce COVID-19 vaccines with the help of PAHO. When the first vaccines from the COVAX facility became available, PAHO's revolving fund delivered them to the region. Here's what it took to get there. For decades, PAHO has worked with countries in the Americas to achieve their immunization goals with a lifelong approach and strong adult immunization services, making it the first region in the world to eradicate smallpox, be declared polio-free, and eliminate other vaccine-preventable diseases like rubella. PAHO helped to analyze and review vaccination plans and consolidate demand to allow all countries to purchase vaccines at affordable prices. Throughout the COVID-19 pandemic, PAHO has supported COVAX, aiming for equitable access to COVID-19 vaccine doses in the Americas. Because we are not safe until everyone is safe.
Olá, eu sou o Marcos. Eu sou um técnico de logística virtual para o departamento de compras da OPAS. Minha função é processar os pedidos relacionados a suprimentos e vacinas no combate à Covid-19. Ajudar na automatização das aquisições para a OPAS tira uma grande carga de tarefas dos meus colegas humanos. Eu posso digitalizar informações, processar informações de envio, preencher formulários de envio e rastrear números de remessa, voos, transportadoras, número total de remessas e muito mais. Eu também posso criar notificações prévias de remessa, fazer o carregamento de dados sobre os documentos de uma remessa e preencher com informações necessárias para efetuar pedidos e compras. Obrigado, OPAS, por me receber.
A very good afternoon to all. Muy buenas tardes a todos. You are connected to the 59th session of the Directing Council of the Pan American Health Organization. We are at the moment confirming quorum to be able to start the meeting. So I would kindly ask you to stay with us for a moment. Very good afternoon to all again. You are connected to the 59th Directing Council of the Pan American Health Organization. You can just bear with us a few more minutes, hopefully not minutes, seconds. We are just confirming quorum to be able to start the afternoon meeting. Thank you. Muy buenas tardes nuevamente. Está usted conectado a la 59ª sesión del Consejo Directivo de la Organización Panamericana de la Salud. En este momento me complace decir que tenemos quórum para iniciar la sesión. El señor presidente del Consejo, el honorable ministro de Salud de Jamaica, tuvo que ausentarse por la tarde. Sin embargo, tenemos el gusto de contar con el señor el primer vicepresidente del Consejo Director, el representante de Ecuador, el excelentísimo señor Alfredo Borreno Vega, que es también el vicepresidente del país, Ecuador. Así que con eso le paso la palabra al señor vicepresidente para que por favor conduzca los trabajos de la tarde.
Muy buenas tardes. A continuación, en el punto...
Ahora sí.
Muy buenas tardes. A continuación, siguiendo el orden del día, en el punto 3.2, informe anual del director de la Oficina Sanitaria Panamericana. Señalo a la atención del Consejo el documento...
The attention of Council Document CD 59-3, and we will continue with the statements by member states. Floor is open for comments, and I invite delegates to please raise their hands in the electronic platform. I would like to ask the assistance of the moderator to coordinate the list of speakers. Thank you very much, distinguished Vice President. We then proceed accordingly, and we will take note of the request to take the floor by member states. We see that Guyana is asking for the floor. Guyana, you're recognized.
Thank you. Thank you very much. First of all, Guyana would like to congratulate the Minister of Health from Jamaica on assuming the presidency of this directing council, and our colleagues from El Salvador and Ecuador for assuming their vice presidencies. We would like to thank the director for her report, the comprehensive report, and to express our gratitude for the leadership over these very difficult times. We are delighted that the director highlighted the need for greater emphasis on mental health, not just in these COVID times, but mental health continue to represent a disproportionate amount of the disease burden and require greater investment in health by all of us. So we're grateful that she highlighted that. We note the disappointment of the director in terms of the fragmentation of COVID-19 vaccine access since the COVID vaccine became available. We share her disappointment in the fragmentation. However, we note the continued inequity in terms of access to vaccine that has forced this fragmentation. Guyana remains committed to the revolving fund mechanism and the solidarity and access to vaccines in general, and hope that we will continue this unified approach to vaccination in our region. But the fact is that in the access to technology and medicine, the inequity that has always existed been amplified during this COVID time, and particularly the access to COVID-19 vaccines. And then therefore the fragmentation is not one chosen by countries. Guyana is one of the countries that went out on its own to get access to to vaccines. That fragmentation has been forced by the inequitable access. The president this morning highlighted the fact that more than 1/3 of our countries are still below 20% coverage. And there are several countries below 3% vaccination coverage at this moment. And this is all not because countries don't want to invest in vaccinating our people against COVID-19, but it is because the poor coverage that we see in many countries and the inequitable coverage in the region is because of the access problems that we have. And therefore, Guyana would urge that we work diligently to ensure removing the existing inequity and ensuring that in future that there is a more equitable platform to vaccines, to medicines, to technology, especially in times of pandemics. So whilst we share the disappointment of the director, we want to ensure that we are all on the same page, that this fragmentation has been forced upon us. Having said that, Guyana also note that many countries are adopting vaccine mandates for traveling. Guyana fully support that, and Guyana itself has adopted measures that fall into the category of vaccine mandates for traveling. But we hope that these mandates are not also used to penalize countries like Guyana that have went on its own to procure vaccines. Our people could not wait on the international institutionalized arrangements. We would have preferred that our vaccination program was based on an international institutional arrangement. But since those arrangements, such as the COVAX arrangement, which has tried valiantly to address the inequity, since those could not guarantee our people early access to vaccine, we went on our own. And for that reason, I believe that regional and international vaccine mandates must take into consideration those realities. So with that, I would like to wish all our colleagues a good meeting, a good directing council meeting. And I thank again on behalf of our Minister of Health, the director for her leadership during this time. Thank you all very much.
I'd like to thank the delegate of Guyana for his intervention. I note the request of delegation of Haiti. And before giving the floor to Haiti, I would like to remind member states to limit their interventions to 3 minutes. Haiti, you have the floor.
Haïti.
On vous entend, allez-y.
Oui, merci, Monsieur le Président.
Thank you very much, Mr. President. Haiti would like to commend you on your election to the position of Vice President, replacing the President of Jamaica's president of this Directing Council, and we acknowledge that the efforts are made by Dr. Carissa Etienne with a presentation of this annual report in spite of all difficulties faced. The general theme of this annual report of the director reflects that our work has attempted to surmount the COVID-19, and it reflects the daily efforts made by PAHO in order to accomplish its mission. The latest months that we have witnessed has showed how the organization is important for the region of the Americas, particularly because of its adaptation capacity in order to provide assistance to our country. Haiti notes the statement in the report saying that health is not a privilege. It is one of the fundamental human rights. And each one of us, be it the government, be it civil society, the private sector, the intergovernmental organizations, as well as development agencies, have an essential role to play in the attainment of this right to health, as well as the fundamental human rights. And in order to attain that, we must persevere in the work we do in order to overcome the COVID-19 pandemic. These last September 16th, the Minister of Public Health and Population has presented its new governing plan for health at 2021-2031. And taking into account the lessons learned during the pandemic, as well as the need to enforce and implement a health system capable of preventing, detecting, and responding to these risks through global and comprehensive reinforcement on the basis of 6 pillars in the health system, following WHO and PAHO's guideline in order to ensure universal access to health as well as universal coverage, but using this approach, improving the performance of the essential public health functions. Haiti wishes to receive major funding and better quality funding in order to put into practice that plan. Thank you very much.
We would like to thank the delegate of Haiti for that intervention. Seeing no additional member states requesting the floor, we will now give the floor to the international governmental organizations attending the meeting. We have the request from the floor from the International Atomic Energy Agency. IAEA, you have the floor.
Thank you. Honorable ministers, dear chair, distinguished delegates. The International Atomic Energy Agency is a technical UN organization with the mandate to accelerate and enlarge the safe, peaceful, and secure application of nuclear science and technology to promote sustainable development, including on health. Jointly with PAHO and the International Agency for Research on Cancer, the IAEA helps member states to develop comprehensive cancer control plans by assisting them to assess their needs and formulate evidence-based cancer policies. In 2022, a new IAEA project will be launched aimed at improving pediatric cancer care and outcomes in low and middle income countries through enhancing medical imaging, diagnosis, radiotherapy treatment, and nutritional support. This new project is aligned with member states' plans for strengthening cancer services using nuclear techniques and with the WHO Global Initiative for Childhood Cancer. The COVID-19 pandemic has had an incalculable impact on the world and on health systems. From the outset of the pandemic, the IAEA has been delivering diagnostic equipment, biosafety devices, and personal protective equipment in countries in Latin America and the Caribbean, as it did in the past for outbreaks of chikungunya, dengue, and Zika. 33 countries in this region were supported, and more than 70 national laboratories strengthened their detection capacities and infrastructure. IAEA is also providing emergency assistance to member states to restore medical facilities and services after natural disasters, like with the hurricanes Eta and Iota in Central America, the eruption in St. Vincent and the Grenadines, and the earthquake in Haiti. I take this opportunity to stress the importance of partnerships. Only by working together can we tackle the great challenges that lie ahead of us all. Thank you.
Agradecemos la intervención de la Agencia
We
Internacional de
thank the statement by the IAEA and distinguished Vice President. We have no additional request for the floor, sir. And then the floor is back to you. Next, I open the floor For Dr. Etienne, I'd like to remind all participants to please abide by 3 minutes for each one of your comments and questions. But now it is Dr. Etienne's turn. So please go ahead, Dr. Etienne.
Thank you, Mr. Vice President, Excellency, Vice President of Ecuador and Vice President of the Directing Council. Let me begin by thanking member states for their kind recognition of the work that the Secretariat has done. But believe me, the Secretariat cannot achieve without the member states. So these are your achievements as well. And we are happy to chronicle them on your behalf and on the behalf of the Secretariat. Let me agree with much of what has been said by our member states and also IAEA. It is clear that our fault lines were laid bare, so to speak, by COVID-19, and the pervasive and persistent inequity was one of the important lessons that was exposed. I don't know if we have learned yet from that lesson, but certainly. And let me also agree with the delegate from Mexico that we cannot just work on COVID-19. It is not the only epidemic that we face. It is a pandemic, but we are seeing an epidemic of NCDs caused by the epidemic of obesity as well. So hence the importance of working in other essential health programs. And I recognize the work that countries are doing in this regard. Alongside the work that they're doing for COVID-19 pandemic. Let me also say and underscore the importance of strengthening our health systems, but with a focus on primary health care. And that was one of the lessons that we need to embrace coming out of COVID-19. And let me remind us, and in doing so, let me thank the current president of Mexico, who with PAHO launched the PHC Compact, the Primary Healthcare Compact 30-30-30, that by 2030, that we will increase the investments in the primary healthcare by 30% and remove 30% of the barriers. And coupled with that, the increased investments to 6% of GDP for health. So it is another reminder that we need to pay attention to primary health care, where people live, where people work, and encompassing all of our persons. Let me also thank the delegate from Guyana, a former Minister of Health from Guyana, who I know very well. Let me thank you, sir, for pointing out the fact that it was almost inevitable that member states would try to procure vaccines for their population. And I fully understand that. We fully understand the challenges there were for COVAX and some of the approaches that were utilized there. The concept was an extremely good one. In practice, it was not as brilliantly executed. But let me say that PAHO has moved quickly to address how do we unify those approaches so that we can ensure more equitable access to vaccines. We have continued the core, and we've worked and had meetings with member states like Canada, US, Norway, Spain, etc., to increase the number of donations of doses to countries to address this gap, this vaccine gap that we are seeing. We've also made efforts through the revolving fund to begin, like the other routine vaccines, to begin the purchasing of COVID vaccines for our member states, pooling our demands and procuring on the behalf of member states. In so doing, we've also worked with the IDB, so IDB could support its members in the finances to access those vaccines. And I'm happy to tell you that our negotiations are such that for the last quarter of this year, that our member states will have access to purchase vaccines under the revolving fund directly. Also, we have been concerned about the inequity that there is in the production of vaccines itself. And so we've worked with WHO and to establish a platform for the transfer of the technology of mRNA vaccines. And so the call has gone out. Member states have indicated their willingness to participate. And tomorrow at lunchtime, we will give the results of how we are approaching and which countries will be involved. But the principle behind this is that as a region, we will produce mRNA vaccines with different member states contributing to the entire production chain. And through this, we will have vaccines as a regional public good. So all of our countries in this region would have access to the vaccines that are produced in our region. And this is towards greater self-sufficiency. And it's not enough just for vaccines. We need also to ensure that for PPEs, supplies like gloves, medicines, etc., that this region harnesses its capacities and capabilities, working as a region for greater self-sufficiency. So let me thank also IAEA, and we look forward to the collaboration with you and through you with our member states as well. Let me thank our member states again for accepting this report, and let me thank you that this represents your work as well. And thank you for the privilege that the Secretariat has of working with you to achieve health and well-being for all of our peoples. Thank you very much.
Muchas gracias, Dr. Etienne.
Thank you very much, Dr. Etienne. Now we're going to move on to the next item. The next item is 4.3. This is the roadmap for the digital transformation of the health sector in the region of the Americas. I'd like to let the Council take note of document CD59/6 and invite the representative of the Executive Committee to report on this item. Thank you very much, Chair. The committee supported the roadmap that stated the specific requirements for producing the digital transformation in the region. There was focus on the availability and interoperability of the information. The Executive Committee stressed the need to establish strict critical safety standards to protect the privacy of patients and also guarantee for the policies necessary for this.
The committee stressed that the importance of the ethical use of data as well as digital literacy. The delegates stressed that the importance of adopting a multi-sectoral approach and for the solution of digital health to be interoperable, equitable, and inclusive, as well as to be adapted to the reality, the priorities, and the needs of each country. In order to attain the objectives of the roadmap, it was essential for governments to invest in their implementation, even with investments in universal connectivity and mobile telephone coverage, especially in remote and vulnerable communities. It was pointed out that the technology required for digital transformation was not available to everyone in the region, which could create a new gap between those who do and those who do not have access to resources. The Executive Committee adopted Resolution CE 168.R3, recommending that the Directing Council approve the roadmap. Thank you, Mr. President, and this concludes my report on this item.
A continuación, le concedo la palabra.
We will now Offer the floor to Dr. Sebastian Garcia Saiso, Director of the Department of Evidence and Intelligence for Action in Health of the Pan American Sanitary Bureau, to present on this item. Dr. Garcia, the floor is yours.
Delegates and representatives of this 59th Directing Council. I am pleased to have the opportunity today to introduce two policy documents that, while closely interconnected as they refer to innovation and better use of emerging digital technologies in health, still determine very distinct and specific policy actions in their own and unique fields. Both documents were originally discussed and conceptualized during the IS4H conference with all countries and territories held in 3 virtual sessions in February 2021 and underwent extensive consultations in their development. I want to take this opportunity as well as to thank the Executive Committee for their revision and valuable comments that have enriched the documents and the approval that brings us to today's presentation. I will refer now to the policy document CD59/6, the roadmap for the digital transformation of the health sector in the region of the Americas. As the pandemic disrupted the provision of services at primary healthcare facilities around the world, existing and newly developed digital solutions emerge as a cornerstone of universal access to health and continuity of care, in particular through the implementation of telemedicine solutions. This widening use of digital delivery provided a learning environment that has drastically changed the way we think about the delivery of health services. The Digital Transformation Policy document aims to support ministries of health to participate in a safe, ethical, equitable, inclusive, and cost-effective way in the digital transformation processes of governments, with a view to accelerating the adoption and implementation of interoperable digital health solutions across all sectors, in collaboration with key partners such as the Inter-American Development Bank, collaborating centers, and national agencies, and through a multi-stakeholder approach that considers the need to include actors across different sectors beyond health, such as telecommunications, education, science and technology, the IT industry, among others, and the cooperation and coordination between the public and private sectors. Digital transformation actions can facilitate the assessment, diagnosis, and management of individual and community health problems in a safe and effective manner, thereby fostering greater equity in access to timely medical care and the appropriate response to public health challenges. Drawing on the Universal Health Framework, digital transformation can contribute meaningfully at several stages that collectively define successful universal health: availability, accessibility, acceptability, quality, and contact, collectively leading to effective coverage. This transformation does not occur automatically and requires a cultural change. Towards this end, it is essential to support digital access and literacy for all, with special attention to the most vulnerable populations. Currently, 3.6 billion people across the globe have no internet access. According to the International Telecommunication Union, an investment of 428 billion is needed to connect 3 billion people to the internet and achieve broadband access for everyone by 2030. Closing the digital divide needs to be prioritized, as we also work to close persistent equity gaps in health and healthcare. Moreover, it should also be considered that access to digital solutions can be impacted by structural factors such as cost, copyright, and intellectual property laws, as well as other determinants such as digital health and data literacy, language, age, gender, geographic area, and disability, among other barriers. The Digital Transformation Policy builds on existing mandates and plans and on the experience of PAHO, WHO, and other relevant organizations in supporting interventions that employ an innovative approach to the development and use of interoperable and interconnected information systems for health and digital health solutions. The policy document, which was prepared with the input of several entities across the Bureau, was discussed with member states in May 2021 and during the 168th Executive Committee, and incorporates their valuable suggestions. Taking into consideration the themes of gender, equity, human rights, and ethnicity, the roadmap presents 8 lines of action on 1. Universal connectivity, 2. Digital public health goods, 3. Inclusive digital health, 4. Interoperability, 5. Human rights, 6. Artificial intelligence, 7. Information security, and 8. Public health architecture. These actions are aligned with PAHO's 8 principles for digital transformation of the health sector, adapted from the United Nations Roadmap for Digital Cooperation that were co-created with member states and presented by the director of the Bureau at the Conference on Information System for Health in February 2021. These strategic lines of actions are also the focus of the toolkit developed to support member states in their own transformation paths, and that it's already available. The Directing Council is invited to review the policy roadmap for the digital transformation of the health sector in the region of the Americas, provide the recommendations it deems pertinent, and consider approving the proposed resolution presented in Annex A. Thank you.
El debate. ¿Ya? Ofrezco el uso de la palabra al Pleno para iniciar
I
el
open
debate.
the floor for the plenary to hold discussions and invite delegates to raise their hand in the electronic platform. I'd like to ask for the support from the moderator to manage the list of speakers.
Muchas gracias, señor vicepresidente.
Thank you very much, Vice President. We will now start to take note of which delegations are requesting the floor for this item. We have Chile, followed by Honduras. Chile, you have the floor. Good afternoon, and thank you, President, delegates. My name is Alfredo Arago from the Health Ministry in Chile. We thank the Secretariat and the technical team for preparing this document in a participatory way. It is clear and specific on what is going to be in the future digital transformation agenda in the region and takes into account the different development levels of each of the countries. Chile is committed to digital transformation for the health sector, and we have been making significant strides. In 2004, we had the InSalud plan, and in 2008, we started a plan for digitalization of a number of different health dimensions in the health sector. And in 2017, we started with the TED-Salud plan. In 2018, there was a new digital health plan that is focused on the patient and seeks to move away from just the physical component of care. This is why the digital platform was created to increase supply for specialists and coverage, making the most of technologies available and improving access to opportunity and equity in treatment. Digital hospitals are part of a system that are part of the traditional model. During the pandemic, the digital hospital became a true alternative for care, as we saw in 2020 with close to 1 million people cared for. And these numbers kept up in 2021 and covered a number of areas like diabetes and mammograms, diagnostics for other diabetic conditions, as well as a number of different diseases. This platform has been playing a key role in addressing COVID-19. It was what allowed for travel passes for individuals to be able to move throughout the country, as well as for foreigners visiting the country. So far, 38 million travel passes and tens of thousands of foreign nationals have been able to come in with a QR code in order to verify that information. Despite this progress, we know that there is a long road ahead of us when it comes to interoperability, universal connectivity, and others. We are currently making progress on regulatory issues in order to provide better regulations for telehealth services, remote care, as well as digital healthcare models for the country. All of this said, we welcome this roadmap as proposed, seeing as it represents an opportunity to develop specific and sustainable steps that help to reduce inequality in access to health. Our country stands ready to contribute to this roadmap. We would like to endorse this solution. Thank you.
Agradecemos a Chile por la intervención.
We thank Chile for those remarks. We now offer the floor to Honduras, followed by Panama. Honduras, the floor is yours. Thank you very much. Vice President, Honduras supports this roadmap for the digital transformation of the health sector in the region of the Americas. It establishes specific steps and concrete steps that are achievable and also guide the sector in a new direction, strengthening the system towards 2030 of ICTs and their use. This will allow for the development of telehealth services as well as integrated information systems in our country and throughout the region. This will happen within a framework that fosters more interagency cooperation as well as interstate cooperation, opening a door to technology transfers and processes that allow for policies, laws, regulations, and standards to speed up our road towards achieving SDGs, bringing into this effort religious, cultural, and all other stakeholders in order to try to ensure that there is universal access to quality health care and improve the lives of our people. By ensuring access to health through digital transformation, social, economic, and cultural development, as well as technology development in the region is boosted. And it turns this strategy into a catalyst in order to ensure that we have a stronger and healthier hemisphere in order to take on challenges like the one that we faced with COVID when the pandemic struck. In Honduras, we have already made progress and are continuing to take strong steps towards the future, thanks to the support of PAHO as well as others, in order to use technology to address the legal and institutional dimensions of this issue. With the cooperation of these ministries, we will have a number of steps taken to improve conditions in the country. This resolution is going to help foster the takeoff and development of this new paradigm for health in the Americas, and particularly for my country. This is why we would like to respectfully ask the Honorable Directing Council to adopt this draft resolution that comes with this very important document. Thank you. We thank the delegation of Honduras. We now offer the floor to Panama, followed by Guatemala. Thank you. Very good afternoon, everyone. Panama was able to attend the discussions for the development of this roadmap. Having a new health culture, we believe, is vital because it is going to help us with our care model without losing sight of social engagement. I can state that in Panama, we had a precedent since 2004 and 2005. We had a number of indigenous comarcas establish a technology system and also a telehealth diagnostic system. We had also set up a virtual healthcare facility. However, given the pandemic and the number of challenges we faced in order to provide treatment, particularly for chronic disease patients, as part of the Panama Digital agenda, we established an over-the-phone telehealth service, which has allowed us to help over 12,000 people in 15 regions of the country. Making it possible so far to print not only results from lab work, but also digital prescriptions. As you all know, Given the prospect of vaccines, Panama established a digital system that is going to allow for the EU to recognize a QR of our national vaccines. In that regard, tomorrow we will be launching a new initiative. It is called Social Inclusion Digital Medicine in the face of COVID-19, with the assistance of the Spanish Health Institute. This is in addition to working together with the medical centers in Barcelona and Spain. We have agreed on one of the key aspects of our outreach work, which is to explain how these services will function in the region. The focus of this initiative will be Central America, where there are hard-to-reach places that are the ideal location for these projects to be implemented. At least we should begin with phone doctor's appointments. Thank you very much. Thank you, Panama. Let us now offer the floor to Guatemala, followed by Brazil. Good afternoon, President, ministers, delegates from member countries, Director of PAHO, special guests. Guatemala is honored to join you all today following more than a year of an emergency at a global scale that has left us with many consequences and great challenges for the healthcare system at a global level, and has tested the structures that have helped people for years. It has also shown that people continue to be the most valuable resource for the healthcare sector around the globe, given its devotion and its professionalism, passion, and hard work. A major part of this valuable resource falls in the category of nurses. As we have heard during this meeting, they are the backbone of skilled medical treatment and care that has risen to the task, not only in my country, in Guatemala, but also throughout the world, to tackle COVID-19. What we experienced last year shows us that a response to COVID-19 requires an operational first level of care that allows communities to first find and manage cases, as well as addressing the healthcare needs in line with monitoring, isolation, and contact tracing, as well as monitoring of vaccine status. All of these are absolutely vital in curbing the spread of the virus. This is why we took specific steps to enhance our primary care and are advancing and implementing the Integrated Network Initiative for Healthcare Services. To do this, we have developed a number of institutional policies that include capacity building for the first level of care through the implementation of telemedicine networks. We have developed a national digital health strategy that creates a concept framework that's in line with the national strategy for integrated healthcare services networks, as well as the care and management models, in order to take strategic steps to ensure that our agencies and our interagency efforts are all coordinated in order to ensure that these technologies are put to use to ensure full access for better health of all of our people. Thank you. We thank Guatemala for those remarks. We will now hear from Brazil, followed by Ecuador.
Good afternoon, Mr. President, distinguished ministers and delegations. Brazil greets the Secretariat and welcomes the consideration of the suggestions made by Brazil in the Executive Committee. The coronavirus epidemic showed the importance of a timely and accurate information as a decision-making instrument, demanding drastic responses by the entire health system. I would like to stress some progress made by Brazil, taking into account that the digital transformation in health, which is covered by the item this afternoon. We adopted the National Digital Communication Strategy that considers 5 pillars, considering the citizen at the very core of the process. We developed the parameters and meters for the measurement of implementation of digital health, including digital activity of health establishments. The country with continental dimensions as Brazil, as you might imagine, might lead to huge changes from one region to the other one. We developed the National Health of Data for Health, the national sector, to collect data on COVID-19 by welcoming, processing, and making available notifications of reporting, as well as a test, as well as occupancy and capacity of beds in hospitals. We take all this information, and all stakeholders in the health system ought to participate through the patterns established by the unique health system. The Ministry of Health, through DataSUS, the IT department of the health system, launched an application that is ConectaSUS, turning into a reality the digital health and the digital platform MDS. So beyond sharing health data such as vaccines, health care tests, and medicines, ConectaSUS enables us to provide continuity in care at all levels of healthcare. The app is made available, allowing patients and health professionals to have historic access to immunization. Thus, both the professionals as well as health managers have a whole set of information for the improvement and the assurance of the healthcare and the decision-making by patients. Thank you very much.
Agradecemos a Brasil por su intervención. Damos el uso de la palabra a la delegación de Ecuador, seguido de Cuba. Adelante. Discúlpeme, delegación de Ecuador, tenemos un problema con su audio, no alcanzamos a escucharlo.
Once again, Ecuador, our apologies. We're having some trouble with the audio. We can barely hear you.
Debe ser la configuración de su micrófono.
En este caso, agradeciendo nuevamente a la delegación de Ecuador.
Once again, we'd like to thank the delegation of Ecuador. We're going to continue with our list, and we will come back to the delegation of Ecuador once we have solved the problem. Ecuador, are you ready? Yes, we're ready. Great, thank you. We'll now hear your remarks. Well, our apologies for the technical issues. Thank you very much, Vice President. Digitalization in healthcare is absolutely imperative for the countries in the region, and this has become increasingly visible during the pandemic. We agree with what is stated in this document on the virtues of digital transformation in order to bring access to the reach of everyone. In this regard, the challenge that we believe is before us is how to increase coverage and connectivity and also ensure that there is digital literacy for both communities and healthcare professionals in order to be able to use technology in a way that is timely, equitable, and effective, and also provide for monitoring and documentation that is efficient, as well as research and knowledge generation for healthcare. In order to continue building in this regard, we have taken our first steps. We have worked on policy and regulatory transformation and working on our database through interoperability, technical specifications, and ensuring that there is a privacy of public data, as well as worked on our first national digital agenda, which is a public policy that creates the guidelines for how to ensure that there is economic, social, and economic development in the region. We are working arduously to ensure that there is the adoption of uniform standards that allow us to take advantage of a number of technological offers, all in line with interoperability, security, and safety, scalability, and connectivity dimensions. We have digital prescriptions and telemedicine involved in this initiative, as well as ensuring that there is registration and monitoring for all patients as part of this network, alongside scheduling opportunities and other digital components. All of this requires policy changes and also ensure that there is protection against unethical use of this technology. We believe that we're going to achieve our target by building on the shared experiences of other countries who are somewhat ahead of us, mobilizing resources and knowledge and technical cooperation as offered by this organization and its roadmap for the digital transformation of the healthcare sector in the Americas. Ecuador welcomes and supports what is stated in this document, which urges all member states to work on implementing digital solutions for better health in our countries. This will undoubtedly contribute to building the capacity of our healthcare systems. Thank you. Thank you, Ecuador, for your remarks. We will now offer the floor to Cuba, followed by Argentina.
Good afternoon, Mr. President. We thank the Secretariat for the report submitted. We agree in saying that attaining the objectives of this national policy will call for the commitment of governments by offering investments for its enforcement. It will also call for actions with other sectors. The difficult economic situation that we see in the region in the continuous impact of the pandemic is an element that could have a negative impact on the expected advancement. This ought to be borne in mind, and therefore the progress in digital transformation in the health sector will not be uniform and standard with all countries. It is a huge challenge, and what we need is a design that will be adapted to the characteristic of all member states in order to ensure equitable access to all population groups, and above all, that we have a health system with technical capacities and human resources that will respond to this objective. The COVID-19 pandemic is an example of the importance of this digital transformation. In the specific case of Cuba, through the joint work done by professionals in that sector with the scientists and other specialists, we developed programs in order to improve the care provided to the population, used in research, follow-up and monitoring laboratory test results, availability of hospital beds, managing the information from clinical labs, telehealth consultation, adequate doses of vaccines applied to the population, as well as the use of tools and mathematical models for the prevention of the behavior of the virus in our population, which brings elements that allow us to adjust the national plan to deal with the pandemic, as well as protocols to provide health care to our patients. Excellencies, we believe that an essential aspect in order to achieve the implementation of this roadmap is to strengthen cooperation between countries and the organization, which will enable us to trigger an exchange of knowledge in the digital transformation processes and to work together on the establishment of shared platforms for all member states, geared to promoting the exchange of the best experiences and carrying out joint research work that will enable innovation and development in the region in this regard. Thank you very much. We thank the delegate of Cuba for that statement. And now we give the floor to Argentina, followed by Canada. Thank you, distinguished moderator, Mr. President. Argentina agrees with the urgent need for a digital transformation in the health sector that will ensure equitable access for all population groups, in particular those that are in vulnerable conditions. Our country prioritizes the implementation of information systems that identify the characteristics and the needs of the population, will enable longitudinal follow-up to integrate people throughout the entire health system, and will provide innovative tools to health professionals as well as to patients with the purpose of reducing quality gaps in healthcare. Amongst the different initiatives promoted during the last year and a half, in Argentina will launch the National Network for Digital Health that has as an objective to improve the exchange of information in the different jurisdictions in the country, bringing together clinical histories of all public and private participating organizations using international standards for interoperability. A national telehealth plan represents an institutional framework with innovative methods and services in the country that will enable us to reduce the geographic gaps and reduce the gap in access to effective healthcare based on health projects that will reflect the needs of health systems as well as opportunities provided by information and communication technologies. Even though our country, as many others in the region, have recorded significant progress, we know that we still have several challenges to face. We agree with the need for reviewing and updating policies, laws, and guidelines with a view to look after the ethical use of data, interoperability, and cybersecurity, as well as mechanisms for a safe, ethical, equitable adoption of modern technologies such as artificial intelligence and blockchain. In this regard, we thank you for the report submitted, and we support the proposed resolution. Thank you.
Agradecemos a Argentina.
We thank Argentina for that statement, and now we give the floor to Canada, followed by Jamaica. Canada, please.
Thank you, Mr. Vice President. The COVID-19 pandemic has brought to the forefront the critical value of data and digital solutions in public health, and we applaud PAHO's critical efforts in providing strategic direction and tackling the issue of the advancement of data and innovation as a means to improve public health and healthcare as a public good. Canada is supportive of regional efforts towards digital health and welcomes the proposed roadmap for the digital transformation of the health sector in the region of the Americas and its accompanying resolution. We particularly appreciate that the document considers critical aspects of digital transformation, such as equity and inclusivity, as well as interoperability. Canada views equity and inclusivity as key issues and considerations in the efforts required to ensure that the benefits of digitization and virtualization of healthcare systems leave no one behind. Furthermore, we acknowledge the importance of ethics, digital literacy, and the protection of human rights in any digital efforts. We also recognize that interoperability is key for sharing standardized information and facilitating the electronic exchange of data and information to support healthcare delivery and patient care. Canada looks forward to seeing how this important initiative progresses. Thank you very much.
Agradecemos a Canadá por su intervención.
We thank Canada for that statement. And now we give the floor to Jamaica, followed by Barbados.
Mr. President, in 2016, Jamaica welcomed the Information Systems for Health framework as the renewed model for approaching the traditional health information system. The high-level Information Systems for Health Caribbean meeting was convened in Jamaica in 2016 And through PAHO leadership and support from international loans and grants, there has been progress made in information systems for health in Jamaica. The first major PAHO-supported activity was the Information Systems for Health Plan of Action that is very well advanced. Other key milestones in Jamaica include the passing of the Data Protection Act 2020, the procurement of ICT infrastructure for 105 primary care centers, the advanced stage of procurement of a national electronic health record system and open platform. Jamaica is utilizing digital health technologies in continuing medical education and to improve access to specialist care with the ECHO model that has continued throughout the pandemic response. Increasing access to healthcare through a mobile app is another utilization of digital health technology that is advancing and will be utilized in our chronic care model rollout. Jamaica's approach to data and interoperability will enable artificial intelligence, geospatial technologies, data science, and other emerging technologies to improve healthcare delivery and health systems management. The COVID-19 pandemic has exposed weaknesses in our health system that can be improved through digital transformation. The need to engage the population using simple and available technologies, including the mobile phone, has highlighted the importance of inclusive digital health. The pandemic has shown that the activities under the plan of action are proceeding in the right direction to increase resiliency of the health system. Support is needed for innovative mechanisms for capacity building, protection of human rights in digital health literacy, knowledge sharing, and strategic partnerships. Mr. President, Jamaica has provided evidence of our support for the digital transformation principles and the roadmap. We support the resolution and anticipate the continued support and leadership of PAHO in this regard. I thank you.
Agradecemos a la delegación de
We
Cámara.
thank Jamaica for that statement. And now we give the floor to Barbados, followed by Paraguay. Barbados, please.
Thank you, Mr. President. Barbados welcomes and supports the introduction of the roadmap for the digital transformation of the healthcare facilities and systems require innovation in our information systems, especially when skilled human resources may not be readily available to execute the myriad of expanding tasks. This transformation is very much needed in our country as we seek to harmonize the efforts of our private sector medical facilities with those in the public healthcare sector. Our recently launched National Cardiology Project and the National Cancer Plan, for example, seek to create interoperability among all urgent care centers on island, private as well as public, with telemedicine being the bedrock for the delivery of these programs. We strongly believe that PAHO, through the Department of Evidence and Intelligence for Action in Health, can provide the platform for the development of a digital transformation policy for our healthcare sector. By accessing regional and global experts, PAHO collaborating centers and academic institutions that have previously supported the IS4H initiative. We also believe that it is possible, very possible, for the Caribbean region to be able to collaborate better, as we have a lot of members of our respective countries that seek medical assistance in other territories. And if it were possible to have a common health information platform, this would make life very, very easy for all of our citizens. So we fully support this initiative and we look forward to the rollout of the program. Thank you.
Agradecemos a la delegación de
We
Barbados.
thank Barbados for that statement. And now we call on Paraguay. followed by Mexico. Please, Paraguay. Good afternoon, everyone. Paraguay welcomes the efforts deployed by the presentation of this roadmap and agrees with the statements made in the same. Undoubtedly, the COVID-19 pandemic has had a huge impact on the entire world, evidencing the challenges faced by health systems when responding to the needs of the population. Therefore, we believe that the role to be performed by digital technology in the health sector is of crucial importance. Its use in a strategic way leads us to considering this as an essential element in order to ensure access to universal coverage. Likewise, we are aware of the existence of this tool, but such as artificial intelligence and any other emerging technology have to support the medical professional in their decisions, which makes it easier to have an integrated approach and a comprehensive care given to the patient. However, we believe that one of the challenges for its implementation has to do with having legal frameworks, regulatory frameworks in order to protect privacy, confidentiality, integrity, and availability of data, as well as treating personal health information. In that regard, Paraguay has been developing several projects in order to strengthen and boosting health information's vital statistics and managing basic data, digital literacy, and telemedicine. Therefore, the proposal of this policy will assist us in expediting the progress that we began years ago towards inclusive digital health. Because of all of the above, we express our support for the approval of the proposed resolution. Thank you. We thank Paraguay for that statement. And now we give the floor to Mexico, followed by Suriname. Thank you very much. Distinguished moderator, the Mexican delegation acknowledges and expresses its gratitude to the Secretariat for presenting this proposed resolution on roadmap for digital transformation of the health sector in the region of the Americas. We agree on the need for moving forward on strengthening digital information systems for health in order to support the development of policies and decision-making based on evidence and capacity building for generation, transfer, and use of evidence and knowledge on health, promoting research, innovation, and the use of technology. In that regard, Mexico has a robust regulatory framework and specialized centers to promote digital transformation of the health sector in keeping with the United Nations approach, to promote the policy frameworks for the rapid, safe, and ethical adoption of digital solutions and thus close the digital divide. In order to reduce this gap in infrastructure in telecommunications and information services, Mexico believes that it is necessary for countries to include in their public budgets the coverage of cellular telephony services, internet, electricity in remote, highly vulnerable areas as a means for improving coverage, timely coverage of medical care and health services. The rural areas in the different countries continue to be scarcely covered, and the digital divide between urban and rural areas has grown. No progress can be made in one and not in the other. It is necessary to have an equitable progress. We ought to deal with mobile telephony, electricity, internet coverage before setting in motion a digital transformation policy. We believe that the policy proposed by PAHO can promote the exchange of experiences and best practices and the strengthening and building capacities at a regional level through international cooperation that will assist in order to improve the common regulatory frameworks in order to ensure the reliability, quality, safety, and security of technology for digital health. Likewise, we support the recognition made in connection with intersectoral coordination mechanisms for the creation of networks of interprogrammatic connection, the exchange of knowledge, as well as digital literacy of the health staff at all levels and the public at large. Thank you very much. We thank Mexico for that statement. And now we give the floor to Suriname, followed by Haiti.
Thank you very much, President and distinguished delegates. I'm Rakesh Gaidar Supul, CMO of Suriname. I would like to thank PAHO for its strategic leadership in the area of digital transformation of the health sector. The proposed resolution underscores the need for a multi-stakeholder approach to the development of safe, ethical, equitable, inclusive, and cost-effective digital health solutions. In Suriname, we have a roadmap on information systems for health for the period 2019 to 2024, which we continue to use to guide the development of our various initiatives in this area. Through the formal establishment of an IS4H steering committee, key stakeholder meets regularly to discuss and decide on priority actions for data management, governance, and innovations in the health sector. This committee represents an interdisciplinary and multi-stakeholder approach and has provided an opportunity for national debate on how to maximize available resources. In Suriname, our IS4H roadmap has led us to some fruitful partnerships, including our current partnership with the IDB and Healthcare Israel to develop an electronic medical record system for the country. Additionally, through our partnership with PAHO and the University of Oslo, we have also been able to launch and utilize DHIS2 to manage data during the deployment of the COVID-19 vaccination program. To prepare ourselves for a more robust health information system for the monitoring of universal health indicators, the Ministry of Health, with technical support from PAHO, is finalizing a health monitoring framework which includes key output, outcome, and impact indicators which the country deems critical to measure their progress towards universal health. The strategic actions mentioned in this proposed resolution reflect a very comprehensive blueprint for countries to utilize as they seek to strengthen their systems. It is, however, heavily dependent on available capacity to implement these strategies, which are in short supply in some of our countries. We therefore welcome PAHO's continued support and capacity building of targeted personnel, including health workers in digital health literacy programs at all levels, as well the promotion of regional exchange among countries that have related technical expertise. Thank you, President.
Agradecemos a Surinam.
We thank Suriname for that statement. And now we give the floor to Haiti, followed by Bolivia. Please, Haiti. Thank you, Mr. President. Haiti congratulates the Secretariat for this roadmap for digital transformation of the health sector in the region of the Americas. This digital technology has the potential of improving access to healthcare services. But in order to do that, we have to acknowledge that we will not get there if the populations, the most vulnerable population, are left behind. Because at the lowest level of connectivity and access to these digital tools, we have hand in hand with this, with the availability of basic infrastructures, human resources, and the necessary tools and devices in order to ensure that access to health. Haiti moves forward and progresses with the implementation of a health care information system using technology for the reporting of the data. Several initiatives are underway, and we are currently working on the interoperability on the databases. Haiti recalls that we must all do this in order to avoid a inequitable transformation of the system be implemented, because that could have productive unfavorable consequences and thus affect more the vulnerable populations. Haiti believes that it will be important for us to read distribution of experiences and sharing of experiences in the region. Haiti supports this proposed resolution. Thank you.
Agradecemos a la delegación de
We
Haití por
thank the delegation of Haiti for that statement. And now we give the floor to Bolivia, followed by Colombia. Good afternoon. Special greetings to all colleagues. And very grateful for giving me the floor. Bolivia joins all the statements made by previous states. And therefore, we want to say that Bolivia, the proposal that is under consideration, struggles for convergence on policies in national regulatory environments, inclusive for digital transformation of the health sector, with a component of ensuring universal access to health, particularly vulnerable groups in society. This proposed resolution is in agreement with the political constitution of the state of Bolivia, our national laws, and the national policy on health. Since there are several points, and I will only summarize one of them in order to show the importance that this entails for Bolivia. In the law of the Single Information System on Health and Information Technologies, which is a part of the Single Information System on Health, tells us that we shall centralize and integrate the information from all institutions in the health sector at all levels of care and will be managed by the Ministry of Health. All entities in the national health system are compelled to provide information in digital format, interoperable and on a timely basis in keeping with our provisions. I will not dwell on reading this. However, I do wish to point out that within this program of the Universal Health Care System, we also have the National Telehealth System, which was a decision of the national government that has been able to include telehealth technology tools in order to reduce social exclusion by promoting alternatives in order to improve access to health, overcoming geographic barriers, using skills and capacities of specialized resources, as well as subspecialized within the framework of a community intercultural family life, as set forth in the national Bolivian policy. The Ministry of Health, in keeping with the programs available in the country, the Tupacatari network, microwave and radio link, as well as fiber optic network, has been part of the implementation of the telehealth system for Bolivia. Currently, the national telehealth system, digitalization of data in Social Security and historic data has also been assimilated by the authority that supervises short-term Social Security information in coordination with the Agency of Information Technologies and the technology sector. This issue is of so much importance that it has been involving the Vice President of the Republic and the Ministry of Health with the support and guidance by PAHO, holds meetings. We've already held 4 meetings. And therefore, it is important for Bolivia to consider this issue. Because of all of the above, Bolivia believes that this proposed resolution, as presented, does not go against the political constitution of the state or national policies, but on the contrary, it supplements it because it encourages us to comply with the same objectives. The Bolivian state has already understood that the road to digitalization of information on health with concrete measures such as the single telehealth system that I've described, as well as digitalization of databases of Social Security for the short term. Therefore, for Bolivia, there are no observations and nothing against the adoption of this proposed resolution as submitted by WHO and PAHO. On the contrary, we congratulate you and encourage it to adopt it. Thank you.
Agradecemos a Bolivia por su
We
intervención.
thank Bolivia for that statement. And now we give the floor to Colombia, followed by El Salvador. Colombia, please. Thank you very much for giving us a floor. We thank the Secretariat for the document presented. We apologize, but Colombia sound is on and off, and we cannot follow Colombia.
Demostrando una vez más la
The
importancia
interpreters apologize, but the sound is cutting off.
de la necesidad de avanzar hacia soluciones digitales en todos los sectores, pero en especial de nuestro sector. Notamos con satisfacción
The
que la hoja
interpreters apologize. So when we have good audio, we will be able to come back.
nacional en materia de gobierno digital y en las cuales hemos venido trabajando desde hace ya algún tiempo. En Colombia estamos impulsando importantes iniciativas que le apuntan a la transformación digital, como lo son la interoperabilidad de datos de la historia clínica electrónica, el sistema de afiliación transnacional, los servicios de información provistos a través de la bodega de datos, facturación electrónica, el sistema de información de incapacidades y el certificado de vacunación COVID-19, que reconoce y se basa en normas internacionales para la firma y uso del certificado a nivel transfronterizo. Asimismo, hemos alcanzado importantes avances en el análisis de datos con desarrollo de modelos predictivos, uso de Big Data, inteligencia artificial, blockchain y la integración de datos de diferentes fuentes con servicios de información provistos a través de las plataformas de datos del Sistema de Información de Salud y Protección Social. En este
We
sentido,
apologize once again on behalf of the interpreters, but Colombia's audio is cutting off. If you allow me to interrupt you, distinguished delegate from Colombia, we're having a problem with your audio, and it is very difficult for the interpreters to follow your statement. Could we come back to you in just a few minutes while we check the problem? It might be a connectivity problem in Colombia, and thus we can have a correct interpretation of your statement for all member states. So Colombia, I ask you to bear with us, and we will come back to you while we give the floor to El Salvador in this case, and we'll come back to Colombia in just a few minutes while we take care of the connectivity problem. Thank you, Colombia, and we now give the floor to El Salvador. Thank you, sir. Distinguished delegates, the pandemic has been difficult in the entire world, but it is a huge opportunity to do re-engineering of health systems. Digital transformation is one of the main strategies that countries ought to adopt on health. We heard about the advantages of digital transformation, not only to make decisions based on evidence, to keep orderly processes and procedures, to use better resources, do better research, and many others. As a government, we're working with PAHO and with international experts from the IDB and several strategic partners that have created a 2020-2024 digital path. There's a stronger push from the president's office to digital transformation that makes it easier to implement this roadmap. A lot has been invested, and this year we will bring together all health establishments, triggering greater connectivity and more data in order to make decisions based on evidence. As I said previously, the roadmap in our country includes a digital infrastructure, integrated systems, connectivity, infrastructure, knowledge management, the legal framework. Therefore, as a country, we fully support the proposed resolution as put forth by PAHO for digital transformation, and we commend you for the initiative. Thank you very much.
Agradecemos a El Salvador por su intervención.
Thank El Salvador for that statement. And prior to coming to the end of the list of requests, allow me to please come back to Colombia, and I ask once again that all delegates please speak at a slower pace in order to ensure that your message is fully captured in the interpretation. Thank you very much. I'll start from the beginning. Can you hear me better? Asked the delegate. The interpreter points out that the sound continues to cut in and out. We thank the Secretariat for this document, which shows opportunities to increase the progress of the region through strategic partnerships. The interpreter points out that the sound continues to cut in and out in an unpredictable way. Interpretation will resume once the sound comes back to steady, audible sound.
en materia de gobierno
De
digital.
Colombia, le pido nuevamente mil disculpas. tenemos un inconveniente de conexión que está dificultando el trabajo de nuestros intérpretes. Le pediría nuevamente hacer un esfuerzo en la medida de lo posible para ver si podemos mejorar el tema de conexión nuevamente para
So again,
asegurar
Colombia, our apologies. We're having issues with your connection, making it difficult to capture message and interpretation. We're wondering whether we could find a way to improve that connection. May I have another colleague from the delegation deliver the message? Would that work? We tried to do some audio tests, but it doesn't seem to have worked. Certainly, please have another delegate deliver the message. Thank you very much to the moderator. I would like to speak on behalf of Colombia to read the statement. We thank the Secretariat for the document presented, which represents an opportunity to speed up the process of the region towards digital health through strategic partnerships and sharing information among countries. This once again highlights how important it is to work multilaterally for health and also to move towards digital solutions in every industry, but particularly in the healthcare sector. We welcome the inclusion in this roadmap of strategies that are in line with public policy when it comes to digital and e-government and issues that we have been working on for some time. In Colombia, we have been fostering a number of initiatives seeking digital transformation, such as data interoperability of medical records, as well as transaction systems, information processes through the databases, and digital invoicing, information on training, and more recently, vaccine certificates. This recognizes and is based on international standards for its use across borders. We have also made significant progress in databases through predictive modeling, the use of big data, as well as AI, blockchain, and data integration from a number of different sources with service and information centers for social health and protection. During the pandemic, we've been able to also develop and use technology that, thanks to interoperability, have been able to provide a more timely response given the need for information in order to manage the COVID-19 pandemic. In this regard, we believe that these strategies included in the proposed policy are going to allow us to continue moving forward and to also step up efforts that the country has already been taking, which is why we support its adoption and ask PAHO for support and technical assistance so that we can implement these policies nationally. We also recognize that this policy proposal includes strategies and specific disciplines that are in other sectors, such as the technology sector, which is why there needs to urgently be interagency and inter-cross-sector cooperation that is going to fully benefit from PAHO support. Thank you very much.
Agradecemos a Colombia por su intervención.
Thank you, Colombia, for that statement. I'm not seeing any more requests for the floor from any member states. We will therefore start giving the floor now to non-state actors in official relations with PAHO who have requested the floor. We're going to begin with the International Alliance of Patients Organizations. Please go ahead, you have the floor.
Muchísimas gracias, señor moderador.
Thank you very much, moderator. I'd like to also thank the director, Chris Etienne, dignitaries, ministers, member states, delegates, and non-state agencies. Our organization is a global partnership made up of close to 300 patient organizations and represents almost 100 member organizations in the PAHO region at this regional session. We would like to begin by thanking the director and the secretariat for the working paper CD 59/6 and fully endorse it. Seeing as many of the member states have young populations with a median age below 30, patients of the future are going to more likely than not be digital patients. Universal coverage for 2030 therefore becomes a key priority for member countries. Digital health therefore also has a lot of potential for improving the quality of life of young people who have non-communicable diseases like diabetes in our region. This segment of the population could hugely benefit from digital health solutions that are linked to issues like diabetes in, for example, digital health services and portable devices, AI, and connectivity that all provide information and timely support that is high quality and specific 24/7. This would allow for not only getting better diagnoses, but also in treatment. Digital health is certainly going to improve for young people and access to medical care, particularly for those who are in remote areas or hard to reach areas, is key. Ensuring safety of patients and quality of services and healthcare treatment provided are all issues that are also benefiting from digital health. We commend PAHO for the work it has done for the 2021-2030 agenda in the 74th Global Forum for Health. We also thank all of those who were part of the Global Day for Health and Safety of Patients. We ask the Council to adopt this draft resolution in Annex A, and we thank you all for this opportunity.
Muchas gracias por su intervención.
Thank you very much for that statement. We now offer the floor to International Health Federation. You have the floor.
Honorable Presidente, distinguidos
Honorable
delegados.
President, distinguished delegates, the Global Federation of the Heart, CLASP, my organization, as well as the NCD Alliance, commend the WHO and PAHO for their leadership when it comes to digital health. We welcome the comprehensive strategy and the roadmap for digital transformation, which are both timely and necessary. I would like to highlight here how important it is to ensure that during this transformation and transition, there be specific attention given to cardiovascular diseases, non-communicable diseases, which are just part of another pandemic, perhaps a greater pandemic. Circulatory and other diseases are the main global causes for disability and deaths. And in the Americas, there is an increasing burden. Population aging is only going to increase the risks that are linked to diabetes and kidney diseases, as well as additional comorbidities and underlying health conditions, strokes, and others. And it also enhances vulnerabilities to other pandemics like COVID-19. The pandemic helps governments to rebuild back better, and there are opportunities to also speed up digitalization for health, such as what we have been talking about. There are testing and vaccine programs, but also in prevention, diagnosis, and treatment for those living with cardiovascular diseases and multiple NCDs. In addition to treatment, focusing on the patient and health equity and data protection are key. The Global Summit for Circulatory Health in 2019 convened over 100 leaders in the healthcare sector, in policymaking, academia, and civil society around equal frameworks for health that are focused on patients and tailored to the realities of each of the countries, and also based on data privacy as well as health equity. There was also a call for support for deeper cooperation between governments, healthcare professionals, industry, technologies, and individuals living with non-communicable diseases. Today, we're echoing that call. We are committed to continuing to work in lockstep with PAHO and other member countries, as well as all other stakeholders, in order to build and share best practices and to better manage cardiovascular and NCD health by using digital health tools. Let's all take action to ensure that we deliver on this promise. Thank you. We thank the International Heart Federation for that statement. Vice President, I am not seeing any additional requests for the floor. And so the floor, sir, is back to you. I offer the floor to Dr. Garcia Saisos so he can provide a response to those comments.
The comments made by delegates and participating entities. First of all, I want to acknowledge and recognize the commitment and progress that member states have made in the last years and that have been highlighted also over the COVID-19 pandemic. Clearly, this is an issue that was key in formulating this policy document. It is really motivating not only to hear the comments, but also to see the progress that we have today in the Americas. And this will be key as we are all jointly seek to accelerate the processes of digital transformation in the health sector. Without a doubt, the digital transformation of the health sector will support the strengthening of the primary care level and the access to health and healthcare at the community level, while also providing the capacity to improve the quality and timeliness of data and its use for decision and policy making it a central element to better structure local networks and support the construction of resilient health systems that are better able to adapt to and respond to populations' needs and new challenges. In this regard, the policy sets out the principles that are necessary to achieve a resilient public health and to achieve the dream of universal health coverage. The digital divide is a reality in our region. There are more than 200 million people without access to connectivity. As we roll out the digital transformation of the health sector, we must acknowledge and work towards the closure of this digital divide as the only way to prevent that it has effects in the potential deepening of persistent health inequalities in our populations. This requires efforts directed at improving the connectivity and the digital literacy of our health sector and the general population, as we strive for not just some, but all to benefit from this digital transformation. At PAHO, we have no doubt that digital transformation will be a critical factor in achieving the goal of leaving no one behind. With the support of experts and collaborating centers, a toolkit to support the implementation of these policies under development, having some of the key components already available to all. This toolkit contains a set of key performance indicators, technical guidance, training resources, among other, aimed at supporting member states to adapt and adopt this regional policy, having at the center the need to move decisively in connectivity, interoperability, governance, and digital literacy. Like in any transformation process, the digital transformation of the health sector needs to be tailored to the specific needs, approaches, and vision in our member states. The toolbox is in this sense designed to be adapted to the realities and particularities of each country. Count on us to advance in all aspects of implementation of this digital transformation policy, a new paradigm that will undoubtedly bring us countless benefits for the region. Thank you.
Muchas gracias por sus comentarios, señora.
Thank you very much for those comments. Madam Director, do you have any comments?
Thank you, Mr. Vice President. First of all, let me thank member states for what is the unanimous support for this agenda item, but only to acknowledge that it was the member states themselves who participated so fully in the formulation of this document. Let me also thank member states for the full recognition, because of COVID-19, for the need to accelerate the digital transformation of the health sector. We can't do it as business as usual. We need to accelerate, we need to scale up, we would need to move towards regional interoperability and regional interconnectedness. We need urgently to address the digital divide and the digital gaps. And we need to move to a place where digital solutions, innovations, technologies are used and open to all, not merely one segment of the population, but all of us. So I look forward to working with member states, certainly through the Secretariat, that together we can accelerate this movement and achieve greater digital transformation of the health sector. Thank you very much, everyone.
I now ask the rapporteur to present the proposed resolution.
Gracias, presidente. Primero,
Thank you, President. Allow me to first test my audio. Can you hear me? Thank you. Proposed resolution roadmap for the digital transformation of the health sector in the region of the Americas. The 59th Directing Council, PP1, having considered the roadmap for the digital transformation of the health sector in the region of the Americas, document CD 59/6, PP2, bearing in mind the commitments that member states have made for the strengthening of information systems for health, vital statistics, critical data management, digital literacy, and digital health. PP3, recalling the principles enshrined by the United Nations Secretary General's Roadmap for Digital Cooperation. PP4, considering the need to accelerate progress toward inclusive digital health with emphasis on the most vulnerable populations, especially those in conditions of greater social, economic, geographic, or cultural vulnerability, and population groups that are not digitally literate or lack internet access. PP5, observing that the member states of the World Health Organization affirmed their commitment to digital health at the 71st World Health Assembly in 2018 by requesting development of a global strategy on digital health, which was approved by the 73rd World Health Assembly through decision WHA 73/28. PP6, recognizing the cross-cutting nature of this policy and its alignment with the objectives of the strategic plan of the Pan American Health Organization 2020-2025 and the Sustainable Health Agenda for the Americas 2018-2030. Resolves OP1, to approve the roadmap for the digital transformation of the health sector in the region of the Americas, document CD 59/6, OP2, to urge member states, considering their own contexts and priorities, to A, strengthen institutional and community capacity at all levels to implement digital health solutions, helping, among other things, to support access to quality health services, to produce interoperability standards with the capacity to generate sufficient quality data, and to generate evidence in the adoption of emerging technologies such as artificial intelligence and blockchain, among others, where determined beneficial. B, increase, promote, and support the participation of indigenous peoples, Afro-descendants, Roma, and members of other ethnic groups in the development and implementation of digital transformation policies, considering gender and cultural differences. C, as appropriate, prepare and implement national and subnational policies, plans, programs, standards, and interventions informed by the roadmap for the digital transformation of the health sector in the region of the Americas, making the necessary resources and legal framework available and focusing on the needs of at-risk populations in vulnerable situations. OP3, to request the director to A, provide technical support to member states in the implementation of a coordinated roadmap for the digital transformation of the health sector at the national, sub-regional, regional, and interinstitutional level. B, promote technical cooperation to assist countries in strengthening health system capacity to include digital health solutions in line with the Sustainable Development Goals and applicable international and regional human rights instruments. C, facilitate the co-creation, production, and dissemination of tools, studies, and reports in support of national policies and digital health solutions. D, report periodically to the governing bodies on the progress and challenges encountered in the implementation of the roadmap for the digital transformation of the health sector in the region of the Americas. This report has now been read, President. Thank you, Rapporteur. Anyone else wishing to make any comments given what was just presented? If there are no objections, I declare the resolution adopted. Now we'll move on to the next item, which is 4.4, policy on the application of data science in public health using artificial intelligence and other emerging technologies. I'd like to bring document CD 59/7 to the attention of the council and invite the representative of the executive committee to report on this item. Thank you very much, President. The Executive Committee expressed support for the policy on the application of data science in public health and for the priority actions proposed under the policy. Delegates agreed on the need to develop and implement policies and initiatives on the use of data science, in particular to strengthen public health data and surveillance and increase the availability of evidence-based information for decision-making. At the same time, the Executive Committee recognized a number of challenges in this area, such as a need to strengthen regulatory systems, protect privacy, and ensure the ethical and transparent use of data. It was pointed out that implementing the policy would require action beyond the health sector, and that the policy should therefore be accompanied by broad national policies and efforts aimed at fostering the development of the necessary capacities. The Executive Committee considered it vital to ensure that data science tools are used in a way that does not exacerbate existing health disparities. Instead, such tools should serve to reveal health inequalities and inequities and provide the basis for addressing them. The importance of representative data sets that include information on vulnerable and underserved populations was stressed. The Executive Committee adopted Resolution CE 168.R2, recommending that the Directing Council approve the policy. Thank you, Mr. President. This concludes my report on this item. Thank you very much. I now yield the floor to Dr. Sebastian Garcia Saizo, Director of the Department of Evidence and Intelligence for Action in Health of the Pan American Sanitary Bureau, to present this item.
Thank you, Mr. Vice President, Madam Director, delegates to the 59th Directing Council. I am pleased now to present the second policy, document CD 59/7, policy on the application of data science in public health using artificial intelligence and other emerging technologies. The COVID-19 pandemic has highlighted the importance of timely and secure access to critical data and accurate and reliable information for decision-making. The pandemic has also revealed many of the limitations that persist in this area and its negative effects on countries' responses, as health statistics are many times produced in a manner that is incomplete, non-interoperable, not machine processable, and or delayed. The data science policy document aims to provide a strategic and technical guidance to member states to create an enabling environment to support general and predictive analysis for modeling and forecasting, identifying trends in areas of public health, as well as to identify advanced digital solutions such as artificial intelligence for improving health analysis and decision-making. A policy for the application of data science in public health will strengthen the region's capabilities to conduct analysis of data related to public health drawn from various sources, including traditional, non-traditional, and unstructured sources, allowing member states to improve quality and timeliness of data, analysis, and its use for decision-making and policy development. At the end of 2014, the United Nations adopted the concept of the data revolution as an explosion in the volume of data, the speed with which it is produced, used, and disseminated, the number of producers, users, and intermediaries, new forms of origin, such as mobile technologies and the Internet of Things, and citizen-generated data and data from other sources. Although new technologies open up the possibility for health analysis to draw upon a plethora of data and information that can provide greater insight into complex public health challenges, they also bring new risks and challenges, such as the risk of algorithm bias in the use of artificial intelligence, for which they need to be supported by robust and clear public policies and priority actions that are based on solid ethical principles for the appropriate use of data. Towards for Health Maturity Analysis, conducted in the 49 countries and territories of the region under the IS4H initiative framework, show that there are great opportunities for better health data management, but also challenges in relation to governance and regulatory issues, critical levels of disaggregation, cybersecurity, and the ethical use of information and data, in particular when using artificial intelligence to process open datasets, as it was also discussed among all countries and territories during the IS4H conference held in February 2021. This policy document, as the previous on digital transformation, was prepared with the input of several entities across the Bureau and was discussed and enriched by member states in May 2021 and received valuable comments from the 168 Executive Committee. Considering the cross-cutting themes of gender, equity, human rights, and ethnicity, this policy formulates the following priority lines of action. 1, regulatory frameworks. 2, data governance. 3, data disaggregation. 4, ethical use of data. 5, ethical use of artificial intelligence and other emerging technologies. 6, emerging technologies. 7, big data analytics. And 8, renewed health analysis. The Directing Council is invited to review the policy on the application of data science in public health using artificial intelligence and other emerging technologies, provide the recommendations it deems pertinent, and consider approving the proposed resolution presented in Annex A. Thank you.
Ofrezco el uso de la palabra al Pleno para iniciar
I
el debate.
now offer the floor for comments, and I invite delegates to raise their hand in the electronic platform. I would like to ask for the support of the moderator to manage the list of speakers. Thank you very much, Distinguished Vice President. We shall proceed accordingly, and we will take note of the request for the floor on this agenda item. We see that the U.S. is asking for the floor, followed by Canada. The U.S. is recognized.
Thank you, Mr. Vice President. The United States appreciates PAHO's efforts to develop the draft policy to advance the application of data science in public health. The priority actions outlined in the report will serve as important guidelines to strengthen the application of data science excuse me, in the Americas, and we're pleased to support the policy and resolution. A priority of the United States is to strengthen and empower our data science workforce and train the next generation of data scientists to enable biomedical discovery and data-powered health. We're also investing in a modernized and integrated biomedical data ecosystem that integrate the collection, storage, analysis, use, and sharing of these data according to FAIR, findable, accessible, reusable, and interoperable practices. We aim to manage data in ways that make it more accessible and transparent, while also considering the privacy protections. And we are focused on promoting interoperable information systems through integrating nationwide standards to promote efficient, secure data access and exchange, bolstering our core early warning systems to provide real-time and linked data on emerging health threats. We're also taking proactive steps to introduce and share machine learning and artificial intelligence tools in ways that address existing health disparities. We encourage PAHO and member states to consider the FAIR guiding principles and their application in scientific data management and stewardship as part of the priority actions for successful implementation of the policy. Additionally, where artificial intelligence and other emerging technologies are used in the generation of global health estimates, we recommend compliance with the Gather principles. We reiterate our commitment to working with PAHO, member states, and stakeholders on efforts to develop and strengthen data science capabilities and the adoption of emerging technologies efforts in the Americas region. Thank you.
Agradecemos a la
We
delegación.
thank the U.S. delegate for that statement. And now we give the floor to Canada, followed by Jamaica.
Thank you, Mr. Vice President. Canada is supportive of the proposed policy on the application of data science in public health using artificial intelligence and other emerging technologies. We recognize that AI-enabled tools have tremendous potential to support improvements in public health and healthcare by enhancing diagnosis and treatment, research and discovery, and access to health services. We appreciate PAHO for being forward-looking on this issue and applaud efforts to provide a strategic vision through a policy that sets a great foundation for regional advancement on AI-enabled tools and other emerging technologies. Canada can support the resolution as presented, and while we have no concerns with the document, we did want to reiterate the important nuance between the references to open data and open algorithms throughout the document. With open data, there are legal and ethical barriers to sharing many types of health data openly, as well as technical barriers to data anonymization. Whereas with open algorithms, many data science initiatives use proprietary algorithms or software that cannot be shared openly. While AI holds a lot of promise to support care, we do want to underscore the importance of ethics, consent, training requirements, and digital and technical literacy in the application of AI in health. In addition to supporting AI, we also want to emphasize the importance of interoperable information systems for sharing standardized information and ensuring that essential health information follows the patient's journey through the healthcare system. Canada would also like to highlight the important role that messaging will play in terms of how these innovations and emerging technologies are presented to public health workers, with the need to ensure that they are framed as an enhancement of current activities and not a replacement of traditional methods. Thank you.
Agradecemos a Canadá.
We thank Canada for that statement, and we now give the floor to Jamaica, followed by Guatemala. Jamaica, please.
Mr. President, Jamaica recognizes the need for timely and accurate data to guide policies, programs, and interventions. The region of the Americas has had to respond to a number of emerging threats in the past decade. In mitigation efforts, some countries have been challenged to present a timely response using data generated from largely paper-based systems and may have limited capacity to conduct higher-level analyses. However, the advent of the pandemic has highlighted the opportunity for the sharing of data, technology, and innovations. In order to harness the benefits of data science, it is recognized that data should be standardized, digital, automatically collected, and analyzed in real time with information security always in mind. Currently in Jamaica, technical support from our partners is being utilized to strengthen our national surveillance system and to conduct modeling and forecasting of COVID-19 data. The use of non-traditional sources of data, such as social media, is being explored by our learning institutions. A 2016 UN ECLAC report on the use of big data in the Caribbean suggested that the sub-region was data poor due to lack of data, restricted data sharing, and capacity and resource limitations. Jamaica reiterates the need for the greater use of data science. In order for us to be accomplished, the policy priorities of development of regulatory and ethical frameworks, as well as data governance, are critical. The emphasis on data disaggregation is a key step in addressing the needs of vulnerable groups. Importantly, the providers of data should also be the beneficiaries of data. As such, we emphasize the need for technical support for capacity building, as well as the establishment of centers of excellence and the development of partnerships with data science experts. In summary, Jamaica supports the approval of the policy on the application of data science, reiterates our commitment to work with PAHO and member states in the use of data science in public health, and underlines the need for technical support and capacity building for countries in the Caribbean sub-region. I thank you.
Agradecemos a Jamaica por
We
su
thank Jamaica for that statement. And now we give the floor to Guatemala, followed by Cuba. Mr. President, distinguished ministers and delegates from member states, Madam Director of PAHO, special guests, good afternoon, everyone. Guatemala agrees with the policy proposed, which promotes the notion that the success of primary health care will partly depend on the use of technologies and improvement in information systems in public health. The country has already been working on quality data production and certificates by gender relevance and linguistic community, among other relevant variables, in order to improve the integrity of the information and optimize surveillance and the control of diseases, accountability, and monitoring of the performance of these systems. For example, with the support of PAHO WHO, Guatemala is translating into practice a manual in order to include the right to self-identification in official statistics published by the Presidential Commission Against Discrimination and Racism Against Indigenous Peoples in Guatemala, CODISTRA, in October 2020. The more detailed certification of data will enable us to continue with the implementation of that measurement and monitoring inequalities and inequities in health in order to improve healthcare services and expedite the in the healthcare services. As well as other countries in the region, Guatemala has information systems for health whose integration and interoperability are still limited to tap, process, and exchange open data broken down in real time, a reality that has been especially accentuated during the COVID-19 pandemic. The many initiatives are promoted by international cooperation on health in the country, even though valuable, have resulted in greater fragmentation, different IT platforms, and verticalization of the programmatic management of information for health, since the results and outcomes in different interventions have not been standardized in the managerial health system. Technical assistance from PAHO and WHO in order to coordinate efforts amongst partners to support countries such as Guatemala in developing interoperability standards was very successful. Information for health with normative standards based on strategies and successful experiences in other countries in the region. And these will be key in order to promote the interoperability of the policy proposed. We should stress that the efforts are deployed by the ministry during the first semester of 2021 with the support of PAHO's country office, WHO Guatemala, to carry out operational assessments of data flows for efficiency and processes, including a pilot exercise to carry out the mapping of information flows in healthcare services, gaps and needs for infrastructure in computer resources and data management on health in order to identify paths and more efficient resources for data management for decision-making at a local level and other levels of the ministry. Amongst additional actions on the implementation and the application of science in public health care services, within the health sector and other sectors and academic institutions to document the existing expertise regarding data science and the possible immediate opportunities to train skills in data sciences and to create networks is considered of great value. In fact, an analysis of information based on the use of these existing tools in data sciences with indicator panels, visualization of data, and analysis tools of the same, including local analysis, could benefit countries such as Guatemala in order to optimize the way in which all actors involved use the information on public health. as has been promoted before the pandemic of COVID-19 in the country, to include data science and public health. And it will be important to have partnerships through a network of individual and institutional experts throughout the region in order to empower the progress that we can have, taking into account as a basis the lessons learned. Guatemala, we would be very grateful if you could finish now. Thank you very much. More than anything else, we simply want to give priority to the progress in the execution cycle and the assessment of the policy. Thank you.
Agradecemos a Guatemala por su
We thank Guatemala for that statement. And I'd like to reiterate that the reminder that was already offered by the Vice President to limit the statements by member delegates to 3 minutes. Now we give the floor to Cuba, followed by Peru. Cuba, please. Thank you very much, distinguished Vice President, Dr. Carice Etienne, delegates, distinguished guests. We thank the Secretariat for the report presented and the valuable proposals in it. We ratify that a policy aimed on the application of data science and public health will strengthen both the leadership as well as managing the complex health processes. Only aware of the fact that the processing and immediate use of data, continuous and accurate data, will enable us to make increasingly more timely decisions. In this regard, the progress attained in this important subject in recent decades became slower because of the pandemic of COVID-19. However, the pandemic itself was used in order to push other projects and activities that foster the use of science in these artificial intelligence and other technologies. The use of these tools for epidemiological research has left with us some lessons during the pandemic. We corroborate the opportunity that we obtained from its use in order to improve access to healthcare services as well as quality and security of health services. On the other hand, the production of high quality data demands more than ever well-trained equipment connected amongst them, teams connected with other sectors, so that the analysis of the results will make it easier to move forward with the strategic actions proposed as support to other policies and approved strategies, and will be used as a permanent road for innovation. Today, more than ever, we use prognostic models, lines of trends, and analysis based on time and spatial data, as well as social and demographic data that contribute more efficiently to the development of these systems and health services. Cuba has a strategy to move forward with information systems and knowledge on health that is based on the training of specialized human resources with a university and technological careers. It is structured based on a statistical information system that responds to health problems, which leads us to the best knowledge on the permanent decision-making process. All of that covered by a science and technological innovation system in the national health system. In recent years, we moved forward with medical robotics, care, medicine, nano neurosciences, amongst many others, which demand to process and assimilate large volume of data. In spite of that progress reached, we believe that we are devoted to a qualitatively higher or superior policy in the use of data, as well as the inclusion of artificial intelligence and many other technologies as a leverage of development for the health system. Excellencies, we support the policy proposed, which constitutes a challenge for countries and for the region. This policy calls for actions that go beyond the health sector in order to become part of national policies that will promote this development on a permanent basis. Thank you very much.
Agradecemos a la delegación de
We
Cuba por su
thank Cuba for that statement. And now we give the floor to Peru, followed by Ecuador. Thank you very much, distinguished Vice President, distinguished Director Carice Etienne. Peru believes that it is necessary for the success of primary health care to use technologies and better information systems in the field of health, as well as the implementation and use of agile tools. And we need to have timely, accurate data of high quality and broken down. This will enable us to obtain information and basic knowledge on health, so that in the future we can facilitate decision making on a timely basis and the formulation of policies for any context, be it pandemics or others. It is high time to say that the situation in each country in the region regarding information for health is heterogeneous. However, that leads us to the existence of major opportunities in order to improve data management for health, as well as the challenges in connection with the governance on this score. Cybersecurity, levels of breakdown, and the ethical use of information and data. Likewise, we share in saying that an essential factor for success is the use of communication strategies and change management, which will enable us to promote the results of data science within the context of public health, and thus to standardize the information that is circulating in each country. On the other hand, it is necessary to deploy efforts on health information that will enable us to introduce data science with the purpose of being able to make timely decisions based on real and accurate data. Regarding the proposed resolution, we agree with the content of the proposed resolution, and we simply wish to suggest the following: that policies, plans, programs, and interventions contain a prospective view in their development. Likewise, we should take into account the current problem, as is a case of COVID-19, and that the development of said documents consider this junction and others similar in order to be adequately prepared in the medium and long term. Thank you very much.
Agradecemos a la delegación
We
de Perú.
thank Peru for that statement, and we now give the floor to Ecuador, followed by Mexico. Ecuador, please. We apologize, but we cannot hear Ecuador. The interpreters apologize, so we will resume as soon as we get good audio.
Delegado de Ecuador, nuevamente lo interrumpo. Creo que estamos-
Distinguished delegate of Ecuador, I will interrupt you, but it seems to me that we're facing the same problem we had previously. It seems to me that we can continue now. Can we proceed? No, we can't.
Estamos listos, ¿no? Bueno, les
We are
decía,
ready. Well, as I was saying, firstly, I'd like to thank the Vice President. Ecuador expresses its gratitude for the effort and the joint work that has been developed in connection with a policy on the application of data science in public health, using artificial intelligence and other emerging technologies, which provides us with an opportunity in order to improve information systems for health as an essential axis in the strengthening of the development of policies and decision-making based on data. It is along the same lines that we believe that it is a top priority to measure and to follow up using these technologies on the indicators that will enable us to assess mainly the inequities in health, that this will enable us to project the risk for disease and death in populations based on their level of income, how limited their access to health services is, as well as the use of geographic information in epidemiological surveillance, which has been proven on how useful it is during the pandemic. Furthermore, we believe that it is important to use technology in order to identify vulnerable groups, as is the case of children in risk of chronic malnutrition, teenage pregnancy, or the young population facing the risk of suicide. Therefore, it should be a priority for public health agendas in our states, as well as having a record of the progress made towards the achievement of universal access to health and universal coverage. Last but not least, Ecuador welcomes the proposed resolution as presented in this document, and we support its approval. since it urges member states to strengthen our institutional capacity and that of health workers in order to use tools and data science methods that will enable us to have adequate management of information and the use of emerging technologies in order to improve and simplify analysis processes linked to health. Thank you very much, Mr. Vice President.
Agradecemos a la delegación
We
de Ecuador.
thank Ecuador for that statement. And now we give the floor to Mexico, followed by Suriname. Mexico, please. Thank you very much, distinguished moderator. Thank you, Mr. Vice President. Dear friends, the Mexican delegation would like to thank the Secretariat for the consultation process held, which has greatly facilitated the review of this document. We agree on the need for formulating and enforcing policies on data science that could be used in public health using artificial intelligence and other emerging technologies for an analysis that is people-centered, based on ethics and the respect of human rights that will protect privacy, that will promote scientific evidence, and will use open and transparent algorithms. In this regard, Mexico supports the creation of a robust regulatory framework that will explicitly consider the following. One, an analytical analysis of methodologies and metrics for the construction of indicators that will consider changes in criteria for social inclusion. These health indicators ought to measure changes in the three main sectors: the social determinants of health, the health system, and the status of the health condition of the population. Two, to come to a consensus agreement on criteria in order to deal with the social determinants of health as it is based on the policy document and instruments of the Commission on Social Determinants of Health of the World Health Organization. Three, to stress the institutional role played by professional and technical staff responsible for statistics in health institutions of all levels, administrative levels, and to promote its worthy participation at all levels, as well as to have funding and equipment for the training of the specialized staff for the professionals to use useful analysis for decision-making in health, that is to say, intelligence for decision-making. Four, to disseminate knowledge through the promotion, coordination, implementation, and organization of strategies and actions that will enable us to organize based on national information systems on health available, analysis and necessary intelligence for prevention, care, and control of damage in the health of the population on a timely basis for decision-making at all levels. We believe that the policy proposed by PAHO can promote the exchange of experiences and best practices and the strengthening of capacities and skills at a regional level through international cooperation that will contribute to the creation of common regulatory frameworks for the use of data science in public health using artificial intelligence and other emerging technologies. Thank you very much.
Agradecemos a la delegación.
We thank Mexico for that statement. And now we give the floor to Suriname.
Thanks again, President. Suriname takes note of the policy and its implications. The purpose of this policy is to provide strategic and technical guidance to member states for the successful development and implementation of data science policies and initiatives that can be utilized in public health through the application of emerging technologies to gather and organize extensive data and information in a coherent structure. Information like health, socio-demographic, medical, and economic data. Data science policies and initiatives create an enabling environment to support general and predictive analysis for modeling and forecasting, identifying trends in areas of public health, as well as to identify practical solutions for improving health outcomes. This regional initiative will offer opportunities for learning among stakeholders in Suriname. Many countries, which have very major health information systems in the region, have begun applying data science in their public health programming. The experiences of these countries and lessons learned can be reviewed by Suriname and considered in the design of future data management frameworks for health. Thank you.
Agradecemos a Surinam por su
We
intervención.
thank Suriname for that statement. And by not having additional requests for the floor by member states, we will now then give the floor to non-state actors in official relations with the organization. We thus give the floor to the International Federation of Medical Students Association.
Thank you, Mr. Moderator and Vice President. Honorable President, distinguished delegates, the International Federation of Medical Students Associations, as a body that engages in daily work with global health and advocacy efforts towards working on the digital transformation of the healthcare sector and the application of data science in public health, we need to acknowledge the inequality faced by the Americas region in the access to technologies that would guarantee equitable distribution of resources and universal health coverage, which is why we call on governments and institutions to support the development of evidence-based health technologies. IFMSA believes that to achieve a clean digital transformation process, it is necessary work under the biomedical research principles and produce scientific publications to apply correct-based evidence decisions making. IFMSA calls on governments and institutions to include young students in the human resources training plan, who will be involved in the interoperability and applicability of new technologies. Currently, IFMSA is running activities on artificial intelligence, infodemic, and open science. In addition, we already have projects for the most vulnerable population. As IFMSA, we commit ourselves to implement those topics not only for vulnerable people, but also for current healthcare providers, to build confidence in the benefits of data science and technological application in the health sector, as well as examining the ethical aspects of data protection and artificial intelligence usage. Thank you for your attention.
Agradecemos al delegado de International
We thank the delegate of the International Federation of Medical Students Association for that statement. And Vice President, we are not seeing any further requests for the floor. The floor is turned back over to you. Thank you very much, moderator. We would like to ask Dr. Garcia Saiso to please take a moment to respond.
Dear delegates, I'm not going to extend myself. Thank you very much for all your comments and congratulations for all the progress made, and especially for the vision. Desde el secretariado estamos listos para apoyar el desarrollo de esta política con todos ustedes.
The Secretariat stands ready to support the development of these policies with all of you in order to highlight the characteristics and realities of every country, previous development levels, and priorities in order to ensure that we have sustainable development in order to address current and future challenges when it comes to health. Thank you.
Muchas gracias, doctor. Señora directora.
Thank you very much, Doctor. Director, any comments from you?
Thank you, Mr. Vice President. Let me thank member states who contributed to this document and to the attached resolution. Really, when I think about a span of 10 years or more, this region has been making progress as far as information systems and data science. We have 49 countries with IS4H plans, and we are hearing member states in a maturity process saying we need to go further. We need to enhance our systems. We need to enhance data science. We need to ensure the capacity building among healthcare workers and to engage even our indigenous people and grassroots involvement. This is progress. And the roadmap that has been outlined here will help us further advance to a point where we can utilize all sources of data for decision making in a timely manner. The Secretariat commits to working with member states and with other partners to ensure that all member states looking backwards can say that certainly for this, the pandemic was a blessing. So we will move forward with you and ensure that never again shall we will hear member states crying, we need help to develop information systems. So thank you again for your commitment towards that, and the Secretariat will be firmly behind you. Thank you very much.
Muchas gracias, señora directora. A
Thank you very
continuación-
much, Madam Director. I now ask the rapporteur to please present the proposed resolution. Thank you, President. I will now read the proposed resolution. Proposed resolution, policy on the application of data science in public health using artificial intelligence and other emerging technologies. The 59th Directing Council. And it reads, having considered the policy on the application of data science in public health using artificial intelligence and other emerging technologies, document CD 59/7, bearing in mind member states' commitments with regard to the strengthening of information systems and data-driven solutions for improving health analysis and forecasting. PP3, recalling the principles enshrined in the report commissioned by the United Nations Secretary General, mobilizing the data revolution for sustainable development. PP4, considering the need to accelerate progress towards the adoption of emerging technologies at all levels of the health sector. PP5, observing that member states in the region of the Americas have officially affirmed their commitment to health data management with the highest level of quality since 1954. PP6, recognizing the cross-cutting nature of this policy and its complementarity with the objectives of the Strategic Plan 2020-2025 of the Pan American Health Organization and the Sustainable Health Agenda for the Americas 2018-2023, resolves OP1, to approve the policy on the application of data science in public health using artificial intelligence and other emerging technologies, document CD 59/7. OP2, to urge member states in accordance with their national contexts, needs, vulnerabilities, and priorities to A, strengthen institutional and health worker capacity at all levels to implement data science tools and methods, supporting, among others, the appropriate management of big data, information, and knowledge through the application of emerging technologies to improve and streamline data processes for descriptive, prescriptive, and predictive health-related analyses to inform decision-making processes. B, increase, promote, and support the participation of indigenous peoples, Afro-descendants, and members of other ethnic groups in the development and implementation of data science policies, considering data biases due to gender differences and other factors. C, as appropriate, prepare and implement national and subnational policies, plans, programs, and interventions informed by the regional policy on the application of data science in public health using artificial intelligence and other emerging technologies, making the necessary resources and legal framework available, and focusing on the needs of at-risk populations in situations of vulnerability. OP3, to request the director to provide technical support to member states for the development and implementation of a regional roadmap for the incorporation of data science techniques and methods at the national, sub-regional, regional, and interinstitutional levels, and facilitate technical cooperation both with and among countries for the preparation and implementation of their national policies. B, prioritize technical cooperation to assist countries in strengthening health analysis capacity, including the use of artificial intelligence and other emerging technologies. C, facilitate access to open educational materials, tools, networks, and scientific information for improving health worker capacity, for data management and health analysis, and for the use of artificial intelligence and other emerging technologies. D, report periodically to the governing bodies on the progress and challenges encountered in the implementation of this regional policy, as well as its adaptation to specific contexts and needs. This concludes the reading of this proposed resolution, President. Thank you very much, Rapporteur. I now open the floor to the plenary for discussion and invite delegates to raise their hand in the electronic platform. I would like to ask for the support from the moderator to manage a list of speakers. Thank you very much, Vice President. We will now record requests for the floor to discuss the resolution as presented by the rapporteur. Vice President, there are no requests for the floor. We turn it back over to you. If there are no objections, we declare this resolution adopted.
Secretaria, si tiene algún comentario o...
Secretary, are there any comments or announcements? I offer you the floor.
Thank you, Mr. Vice President. There are a few announcements. Let me please remind our delegates and members that the second meeting of the Working Party on 6B will meet tomorrow morning at 8:30 a.m. using the same link they used today. And that is 6B is Honduras, Peru, and Antigua and Barbuda. The second meeting of the Committee on Credentials will meet tomorrow at 11 a.m., again, using the link that you had previously. And that is Panama, Paraguay, and St. Martin's. And then we are incredibly excited to invite all of you to a side event tomorrow on technology transfer for the production of mRNA vaccines. This will occur during the lunchtime break from 1 to 2 p.m. And you will use this link to be able to join and participate in that event. That's all for the announcements, Mr. Vice President. I will return the microphone to you.
Señora Secretaria.
Thank you very much, Secretary. To conclude, we would like to say that tomorrow we will begin at 9:30 sharp with the program as follows. We are going to take up items 4.5, 46, 23, 51, 52, 53, and item 2.1. To conclude, I would like to thank everyone for your remarks and give a special thanks to the director for giving us this opportunity as member countries to participate. And we look forward to seeing you all tomorrow, God willing. Thank you.